to ensure that they provide respectful what? Care. Now, we are trying to understand what are those factors that hinder our facilities or stop them from providing the required care. So these issues we are putting in different thematic areas. They are policy and guidelines issues. There are issues to do with the financing, planning and management, issues to do with human resource. There are issues to do with the service delivery, then issues to do with information monitoring and evaluation. Okay? So when we go to the different thematic areas, can we go to the next slide? This slide looks so congested, but specifically when you look, we have restrictive policies. We have restrictive policies in a sense. Who can give an example of a restrictive policy? Mister, what is a policy? Sorry, I don't know whether, but this is an interaction. You know, we need to be together. When we talk about a policy, what do we mean?
A policy is an idea put in place to ensure implementation of something.
Okay, standardized implementation. Okay? For example, I normally use an example. We are seated here. What's the name of this hotel? Green Valley. Yeah? It is not by accident that we are given water from this bottle. I mean, using this bottle. Maybe if you had gone to Serena, probably by policy they say those who are in workshops, we are not supposed to waste our glasses. But in Serena, their policy would be, for us as far as we are concerned, no customer should be given a bottle to drink from. Are we clear? Now, even ministry set certain policies, and you find these policies restrict how we deliver some services. For instance, when you look at our health facilities, do you know the different levels of health facilities we have?
Yes.
Yes? The topmost is National Referral Hospital, like Mulago. Then from National Referral we have Regional Referral, like Ginger. Then from Ginger we go down district, up to health center what? 1. The last is 1. Do you know health center 1?
How does it look like?
Which one? 1? 1 is the VHT. This is those are now the ones supposed to ride the people to facilities. Now, they set certain levels of service providers. For example, they will say, health center 4 is supposed to have 1 doctor, not so?
Yes.
I think it's 1. But you imagine, how many of you come from Uyende? You know Uyende. You know how busy Uyende is. And can you imagine 1 doctor, however strong you are, can you run Uyende alone?
The whole district.
That is now, you know, health center, they divide the districts in some way. They are what we call health sub-districts, managed by health center. The overall facility is health center 4. And that health center 4 is supposed to do operations, all that kind of stuff. But the current policy says that health center 4 should have 1 doctor. You want to go for a wedding. And now we are saying women should be attended to with the most skilled people in the most urgent way. And don't you think that is a policy that denies us the ability to render service in a respectful manner?
Yeah.
Okay.
So they have an emergency when he's even not around.
He's not around. He is a human being. He can fall sick.
Yeah.
So that is one of the few examples. Now when we look at service delivery. So why am I bringing out this? You are the pressmen. You are the media. Sometimes when you go and something like that has happened, you need to have this context. You need to know these things. Such that, yes, this happened. What was the human challenge here? The woman came, the doctor was not there. I think we are clear. Then service delivery, you find that there are these quality of care standards that I've briefly discussed with you about. But one, if you went to the villages there, you will find that probably 50% of the health workers know those standards. But in addition to not knowing most of them, even efforts to supervise these women, I mean the workers, about those standards are not there. Okay? Then, Information at the national level, this is where maybe where we need your input. Eh? We are aware there is lack of awareness by the community about the human rights, their traditional beliefs. There are so many other issues. Okay? And human resource, these things we are talking about when we are in school, it is very rare in any curriculum for any medical level where they tell you when you are managing, you must ensure respect, or you must ensure women's rights. Those things just come out when we are now in workshops. Okay? So, I think finance, planning, one, we don't prioritize our needs. Okay? Maybe, okay, who is the, please, next slide. We don't prioritize our needs. We don't specifically target some of the things we are talking about. That less on our agenda, in our budget. Instead of organizing a workshop to show people how to inject, let's also organize a 2-day workshop to talk to people about human rights, patients' rights, and even themselves, their rights. You know, as health workers, we even don't know our rights. Okay? Now, these things translate down from the national level. The same issues come down, although now they become more local. For example, when it comes to human resource, you just find fewer numbers. Next slide. Then the environment. Yes, when we talk about rights, we are talking about treating people with respect, talking about managing people with dignity, effective communication. But what is the most way of respectful care that we experience in facilities? Because someone has come to deliver, she's my wife, she's pushing from here, she's his wife, she's pushing from where? From there. She's totally naked. Really, even if someone has come to deliver, must it be a rule that she has to be watched by everybody? We are talking about that for us to treat these women with respect and dignity. If she wants her husband to be there, he should be there. If she wants her aunt to be there, he should be what? There. But how will this man be in presence of my wife? Because what is happening now, you find our facility, the ward is like this room. This is where women come and get displayed. Of course, she will not have a chance to get a companion of her choice because of infrastructure issues, because of the working environment. I think I always ask people who have witnessed someone who is giving birth, who is just going to give birth. Have you ever witnessed one?
Really what?
Someone delivering.
I would have witnessed, but she would.
Imagine you've delivered at night. How will you go in that darkness? So, basically, the environment so far is not attractive enough to ensure respectful maternal care. Next slide.
Excuse me.
Yes.
You said you have first bathe, then you go for.
Who has pushed the baby here? This one seems to have not pushed.
Now, let me give an example.
Eh.
I've worked with the Infectious Disease Institute in Makerere under Saving Mothers Giving Life by the Inspired District. One time we went for the field with, it was me, a nurse, then a medical officer. So when we reached at the facility, there was no doctor, and they had referred the patient to theater. What the doctor did, and the person on duty was the nurse, because before the nurse and the court personnel only. So what the doctor did, he said, there's no time for this, the mother's dying sick for her. Just put a little, they not go for money by the, yeah. They wear those things, gloves, they enter the theater. I was also there, because there was the president now. Oh, yes, I was also there. So, I'm imagining there was no document signed, there was no, because now the patient came with only the guardian was a young child.
Ani atana doctor won't. So these are things we are talking about. Because when you are going to operate, ideally the patient should go when she's clean. Even you, the doctor, you need to go when you are clean. Because we are even supposed to take off this one we are putting on, change and clean. Okay?
He was after saying this. Yes, actually I'm concerned about his statement, as if he's trying to say that in case where when you spend time going to bathe and so on, somebody's life is going. So can't you at that moment say, okay, now let me leave this apart, we first go and save life. So to have those
It is an emergency.
Yes, it can be an emergency, like 5 minutes going to bathe and so on, somebody's dying.
The way you are putting it, it's like, for instance, a woman has come. She has failed to push to deliver the baby, and I'm supposed to operate. But at that moment, there is not a single pair of what? Gloves. Are you suggesting, because I must save this woman, let me just go with my bare hands and open? So some of these things, I mean, they may be no first hand or whatever, but you put them in context. There are things where you do more harm than what? Than good. You get what I'm saying? Eh? Because if I fail to deliver, and this doctor who wants to operate me has no gloves, all he has is no surgical blade, nail, let me sharpen a knife around, you will be doing more harm than what? Okay, a razor blade. Eh? So I think, but ideally, by the time they reach that extent of just rushing to theater, when in that kind of urgency, then there must have been something that went wrong. Because you know, labor or money, the process does not just happen like a miracle. There are indicators that you follow and you know the way this person is in the next 3 hours. This is where I might be heading to. Okay? Next slide, Chief. Is it with us? It is here. Eh? Now, we are looking at issues at the national level. Really, I've just overskipped most of the things because I'm sure there is nothing very new with most of you. Then we also looked at their facility level partnership factors hinder the implementation of RMC Charter. What we established was poor health work community relationship. Community here involves the leaders, involves the supervisors, involves you, the media. And lack of appreciation of services. You see, you media, you say, when dog bites man, it's not news. But when man bites dog, it is news. That's your argument. Not so? But for us again, sometimes, out of their 1,000 good things they have done, you keep quiet. You can never praise Dr. Ramadan. This time he has this year has been the most wonderful one. But let me make one mistake. Then, you know what it means. I may also shun you for what? Forever. Especially if whatever you are reporting on is not factual. And I don't know the right word to use. By the way, 99% of health workers, whenever they are managing a patient, they want positive results. There is no one who can ever get pride in harming or aiming at poor results. But you know what usually happens? Someone comes, sometimes, yes, there could be negligence, but sometimes you blow certain things out of what? Proportion.
No.
And for us, we don't forgive.
Ask for money. I witnessed a woman who was giving birth in Kamuji Hospital just on the veranda, and the doctor was saying that not only give me the money, that he should be taken to the theater. That's when one of the district councillors came for help. The moment the doctor saw us with cameras, then he rushed very fast to take the woman to the theater.
There are so many of those cases.
That is very good. That is very good. Actually, the good thing you are saying, there was what? The doctor. But you know what media, what you normally report? When you get that one doctor, now your phrase will be doctors in Kamoshi. Even me was never got a single point. Then when I meet you, this is we're just trying to enlighten ourselves. And I'm not defending doctors, but I'm just trying to report. And I think we were with you in Kamushi.
Yes.
We were who else? He was there.
Yes.
You remember the reaction of those nurses towards the media? Or even him is from Kamushi actually.
Yes.
We were there. Reactions from the nurses concerning doctors and politicians. Sorry, not doctors, but the media and politicians. Actually, they were like saying, when most politicians get through their campaigns, the first thing, the first war or the first fight they engage in is to fight with health workers. And you see that working relationship may not be what? Good. Can we continue? So, of course, we have mentioned the politicians interfering in day-to-day duties of what? Service providers. You know how they do this. They cited irresponsible reporting on health by what? Media. You can explain. Do you believe that statement, that assertion is true?
No.
So, look at an incident.
We are in Kamuli. You validated this information.
There was an incident in Kamuli. It was COVID time. A COVID patient was brought to Kamuli Hospital. He was struggling as if he was in pain. So the doctor asked the attendant that you go and bring some painkillers that we give him. But when the patient was given the painkiller, the patient died. Now, every patient and the attendants had to run from the hospital that they are killing people. And they called us.
Full stop. Very good. Do you know irresponsible reporting? For example, when you are reporting about such a case, how would you report it?
Now, doctor, who gives you that report? For you, you find people running the doctors, health workers are killing the people. You rush to the hospital, you find somebody, the owner of the patient, the owner of the body is crying. The doctor, now what should you do?
Me, I'm not a media person, but you find someone who's brought in is actually bad off. The doctor says, let me get this person. The person dies. Do you know what your media will say? Doctor killed person.
That was revealed later. After like 2 weeks.
That what?
That the patient was struggling, was in a great pain, and the doctor asked for painkiller, but when the patient was given a painkiller, he died.
So the responsible reporting would have been?
Even the MS did give us the moment.
But I think you get the message. Is it clear? Maybe sometimes, by the way, many times, when you get facts, like in your case, you never even shared it in Kamuli. I'm sure there must have been a reason. But unfortunately, you are not given time to explain to you. By the time someone transfers a patient from Kamuli to Kamuli General to Kamuli Mission, there must have been a very strong reason. Yes?
But I think what means that, more especially in the health sector, you people, the doctors, the health workers, you are too reserved. You are too inside. You don't want to communicate with the media. That's the question. And when you deny media information, you just know they're going to write when they see. But when you come out and explain clearly to them, they will also understand it and do what you want to be published. What you call responsible reporting.
Yes, you are right, but there are many factors, I think. You are aware, in many organizations, not everybody is authorized to do what? To speak.
Now, it is worse in the local governments. They tell you it is the cow. The cow is not always in the office. In Kampala, where. No, you find yourself there. No one will communicate.
And me, maybe, the other thing I've found, you see lawyers, that's when sometimes they beat us. A lawyer, by the time he goes to court, he will have done a lot of his homework. Actually, he can make a doctor look a fool. Because he would ask you things to do with medicine and you can't do what? You can't answer. Yet, for us, maybe media, when you're writing a story, there are some things we can write and say, but this man, oh, what is he talking about? It is like these Mukarakasa people who says, now this drug I have, it can even dissolve this swelling. And you know that such drug is what?
Within 30 minutes.
Within 30 minutes. And assuming now you are called, yes, there was Dr. So and Mukarakasa man. You found some is fasting down and say, is something like it scientifically there? Can you go ahead?
But I think before we go ahead, we need to streamline something more specific in the health sector. Because there should be someone who is professional on that line who speak to the media.
I think that's the hospital administrator.
Maybe it's all the hospital administrator, but most of them, they don't.
In our district,
That's
the spokesperson is the communication officer. So when you go to the DHO, she refers you to the communication officer. This communication officer, she doesn't know this technical language which
we use.
So she ends up giving you information which is not in line with the story she wants to publish.
Yes?
Maybe to supplement on that, to be sincere, there is something has to be done. I'm taking an example, please, where maybe people running from the hospital saying the doctors have killed somebody. To most of you, the health workers, you think if you keep quiet or when you preserve yourself, maybe the media will have nothing to write. And even us on our side, we have a rule, we cannot kill a story. Actually, even your bosses will say, what's going on? No, this one is saying, so you may end up using, now I'm just giving this example. Patients are running away from the hospital. The womb of the patient, actually somebody was died, is there crying. My boy has been killed as a. So as a journalist, I think Dr. Mana said it well. Mr. Mana, he said that he said that journalists, we are not supposed to maybe to use our own words. For that case, if he had maybe a recorder or even a camera, who record that person is saying they have killed my patient. He was okay, he was here breathing, he has been killed. Now it is you, the health worker, either the PR or any other person to say, no, it was not killing, but you wanted it to save life. But most of you keep the information. So the public will take that, will take somebody else.
You know the other challenge? When you talk about a spokesperson or whichever person, remember at the district structure, I think if there is anything, the only facility that can have a cadre of that nature is maybe the district hospital. Otherwise, the rest, these are the policy restrictions that we are talking about. Because the rest of the facilities, you cannot have anywhere where they say, this is a spokesperson for Buyaga Health Center 3.
They are not there.
Now you are asking this midwife, during her training, she has never been trained how to communicate with the media person.
But still, it can be done through your structures.
Yes,
But
if you
why
don't
is
change
it?
it,
Yes.
that
Why should
relationship
I
will
come
come
in
on.
a story maybe let me say cancer. And I call the doctor, he can now going to give me how cancer attacks.
Yes.
Why are you first to give that information?
Are the two the same?
No.
Eh?
No.
I'm not sure, I'm not, but I think the two are different. Yeah? Finally, because I think my time is.
Maybe what I'm saying,
Mm.
there is a communication breakdown in the system. And when a journalist is looking for a story, and because you must dig out the facts. So as you are digging out the facts, but the custodian of the information is hiding. That's where we get a problem.
Yes.
I think it goes back to what you are talking about. I think the government, the structures must be restructured. That at every level, there is someone at least who can say something to the media. Otherwise, such things are going to be recurring because, like, if you take his example, someone is crying. You understand?
Doctor has killed
Yeah,
my
the
patient.
doctor has killed. There is no one who is going to
clarify,
that
yes.
information. But if he's there, a journalist is not someone who is, like, let's say, a sadist towards a doctor that is going to report something like that. But if the information is lacking, and you see this story can at least run to tickle you up, to come out with a press statement refuting what we say.
Okay. But I think this is now the importance of such interactions. Yeah? And of course, eventually, finally, by then we realize sometimes certain things happen, and even health workers, even a doctor cannot explain why someone has died. Like that one, someone was sick, you've given an injection, and the person died.
It was a COVID.
He was a
It may not be. Why should you die because you are COVID and I inject you? Must you die? If he says COVID, then the following day they find something different. It will be another headline. COVID patient has now died of what? Eh?
I have a suggestion.
Eh?
Since this organization is aiming at respectful maternity care, we should also engage those hospital spokespersons or like a clinical officer that heads the health centers. But when somebody actually is at the hospital, let him or her come out and explain to us. Because for us, we shall file our story, and the editor likes it very much. He wants to go
Pastor, I will not sideline with my colleague. As I told you from the beginning, we're always in the field, and we try to look for this information. But by the time, in most cases, I try to communicate and I get these people. But when you call, they will tell you, one, I'm not on the ground. Two, let me call. By the time he calls, by the time you call him again, you will have switched off the phone. That's why you find that journalists at the end of the day, because he has already called what the HROB wants the information to run, out of the 20 minutes, then he continues with his story. So even if we bring these people on board, most times they dodge, I'm telling you the truth.
Maybe.
Am I right?
Maybe.
Not most of them.
Maybe.
And when the story is published, they start complaining.
One clear thing, our opening, like those standards, we said one of our shortcomings, one of our challenges, is that even us, we don't know how the rights we are supposed to observe as health workers. We don't know that proper communication is a requirement. So, as we are sensitizing you, the journalists, I think the next phase of the sensitization will be on the side of the health workers. So that, yes, it is a requirement that if someone is asking you, you are supposed to do what? Respond. But as you are responding, respond where you have facts. If someone is saying, you say, yes, I have given the injection, the right dose, you are at the right side, but the person has died. I can't explain what has killed this person. And maybe we shall go postmortem. But you also try to interest yourself in reading a little bit about circumstances you are reporting about.
Yeah.
Because some of us, by the way, when you read your stories, you say, but this man who says, I don't know the best example I can use, but you can write a story and you wonder, this media person, has he ever gone to any school? Eh? Okay. Please, was it my last slide or? So, of course, the other thing is a generalized body image. Eh? A generalized body image of public what? Facilities. However much you do, when people are biased, they expect nothing. We found that as what? An issue. Yes, next slide. And of course, there are also patient-client-related what? Factors. Some women are cooperative. Eh? Then we also found that there are also negative attitude of patients or client towards certain service providers. An example, some women don't want to be delivered by male nurses. Eh? I'm told this was not here, but was it in Saudi Arabia? A woman went to a facility to deliver. It so happened that the female doctor, obstetrician, was not around. And the gentleman who was around volunteered to deliver. So when the woman went back and reported to her husband that, you know, my daughter was not there, but so and so delivered me. The man just picked a gun and went. I think he either killed him or deformed him. Eh? And of course, things like a lack of awareness about patient rights, mothers and families not meeting their obligations. You know, we never have enough resources. You are 9 months pregnant, you come to me, I tell you I don't have 2 pairs of gloves, but you can't even pluck out some, produce 1 pair. What do you want me to do? I will just abandon you. Then the story, my friend will just say, doctor abandoned is what? But you've been pregnant for 9 months. Eh? So there are many other client overload, weird social, cultural behaviors, beliefs and what? Communication barriers. For instance, an example here, there are people who can't talk, people who can't hear. None of us are trained in sign what? Language. You come, I look at you, I just guess, at the end of the day. Okay? So, next slide. This is basically a cycle. I don't need to repeat, because when the families, you abuse me, you harass me, I'll treat you badly. I treat you badly, the outcomes will be what? Bad. Let's just go, next slide. We tried to find out. This question, we would go and ask these women, tell me, does RMC mean? And we found Masindi, people who could respond relatively to the answer, people who knew what it is, we are like a 30.8%, and at least Kampala was fairly well, a given number knew. Next slide. I don't want to go into details of this, but there are so many issues concerning COVID that resulted into abandonment of mothers and newborns by health workers during the entire process of what? Delivery. People were feared of contact AIDS, COVID, transport facilities were not there, so many things. Yes? I think, let's just skip this slide, let's go to another one. Recommendations. I'm not going to read word by word, but we set recommendation at national level, recommendation at district level, in consideration of the gaps that we have highlighted. Are we clear? I think I don't need to go into this, but the key thing is that we must sensitize the community, we must sensitize the health workers, we must sensitize you, the media people, to report, to be more sensitive and report more what? Sensitive. And to get some clue about health, such that if someone tells you something, there is a way you can say, no, it is not possible. Okay? Please, next slide. Next. Human resource, all those are the nitty-gritties. Recommendation. Of course, some can be applied to us, but some are even beyond our abilities. Finally, I think, briefly, that's what I had to share with you. Those were the issues that we found I think we are discussing, but if there are anything that you feel needs further clarification, please, I'm around. Thank you.
Thank you very, very much. How about you? You were
Thank you, Dr. Lukoda, for this elaborate insight into the issues that were highlighted. Now, for our colleagues in the lab, this information basically helps us to touch base with the realities in these districts. But here is the thing. It can also be used as a yardstick to give a snapshot of actually what's going on. Because most of the issues here, when you generalize them and you look at them, they are not particularly unique to only these 4 or 5 districts. I think it's a good representation of what might or might not be happening in Uganda as far as respect for maternity care is concerned. Now, when you begin to look at some of these issues, you also see the interlinkages that we talked about in the morning. That how far deep does this issue go? And when you look at an issue, can you analyze it past that particular issue, and then you ask yourself questions such as, why is this happening? What are the influencing factors that are pushing this? Because that's where the greatest story lies. And that's where we need to go, especially when we are doing media advocacy. That at the end of the day, we'll always see issues coming up, but to investigate and appreciate why these issues are happening in the first place is a much better conversation for us to have. And that is where we can find most of the issues we want to use in terms of building messages, building stories, pitching ideas, and setting up an agenda. Okay? Remember, ultimately, that if all these issues that Dr. Lukoda just helped us to navigate through are responded to, then at the end of the day, we are going to see a much better society where the women in Uganda, the mothers, get to appreciate and enjoy their rights during pregnancy, when they are giving birth, and the postpartum period that Dr. Lukoda talked about. Okay? And these are the key issues that we always need to always keep at the back of our minds, that, okay, we've listened to the issues, where do we begin and where do we want to go with this journey? That is always very, very important. And particularly, maybe one of the other things that I might want to highlight is that once you go and investigate a particular issue, it's also giving you a chance to say, I need to see the bigger picture here. And then also to always keep in mind that whatever issue we see, even if it's an issue that became an item of interest at the health center point, an item of interest can go beyond where we see it happening. Take, for example, if you covered a story of a mother who unfortunately loses her life or loses the baby, okay? It could be that the story behind that unfortunate event is giving bear to the facts that maybe this woman never even visited or never went for antenatal care in the first place. But to find that out means you took an interest to really get to the bottom of the story. Okay? It could also be that it's an indication that actually our system and our service providers are extremely fatigued. Remember that issue I told you. For example, if you really wanted to understand what service providers go through, don't go to them only when there is a crisis. Pick a day and you say, today I'm going to go to which hospital did you talk about? The referral. Kamuli General Hospital. And you say, I'm going to go talk to the in-charge and say, look, in-charge, I'm here, perhaps not to do anything today, but I came to seek for your assistance to give me permission to spend a day at the labor ward. I want access because I want to understand what your people go through. Go with that kind of narrative and see how this in-charge is going to respond. They're going to say, when are you going to come? No, we can even take you now. Really dedicate and spend a day from the morning and just observe. And if they've given you the opportunity to ask questions, do, but do not interrupt their workflow. Their workflow. Try and be a passive observer. Learn for yourself. That will give you the best indication of what it means to be a midwife. Okay? We have midwives who are in, was it in Kamuli? I think we were with him in a meeting, in a validation meeting, when we heard from some midwives who are telling us, ladies and gentlemen, we need psychiatric evaluation and help and support. They need counselors. Now imagine when a midwife tells you such a statement, you can take it lightly. But they were telling us there comes a bad week where I see like 10, 12, 6 babies dying. Some I can try to help, but because of logistical issues, I fail. Others, then I see mothers dying. Then I see this and that. Then I'm tired. And they break down. And when they get these problems, they get these breakdowns, they're supposed to seek for help. So they are sent home, maybe with medication. Rest. You need to relax. You need to rest. Because they're emotional. It has really got to them. And this same midwife was telling us that, but it's unfortunate and painful that sometimes when we check on Nancy Ashraf or Nancy Jane or Nancy whoever, and we realize that, actually you are okay, ish. We recall you immediately. Because nothing not too far. The numbers are small, the women are just flocking in. Another reality that was shared with us, and we also got the same indication in Rubaga, was that usually when they do these demographic health surveys, and they do census is done every decade? And I don't know if in Uganda we've stuck strictly to the decade. Sometimes now we've overrun. Because of COVID, because of elections, because of what? So many things have come in. In the past, it used to be consistent. But I can tell you, when they do the census, it informs the planning. Now, the last census we had, whenever it happened those so many years ago, is what is informing the planning up to today. So when you go to that referral hospital, the matrices that they are working with, and this was the testimony that the health provider was telling us, they're in charge, that some of our hospitals, the geographical coverage has expanded extremely because of easy movement and transportation and the like. A hospital which was supposed to serve a district is now serving like 4, 5, 6 districts. People are coming from as far and they are coming for service. And they feel entitled because they say health services in government hospital are what? Free. So they come in. But national medical stores, their supplies, are they in tandem with the numbers that are flocking in the hospital? These are our realities. Okay? So when you hear the word, gloves are not enough, when the medication comes in every month, it almost disappears. Don't only rush to think that sometimes that medicine comes in and the demand is there and it's given, it's distributed, and they run out. But the next batch is going to come when?
Doctor, that is times where the problem comes from. Because when we were in Kamuli, somebody raised an issue about the interference of politicians. Because for them, when they are canvassing for votes, even when they are through, they tell the people that the services at the government health centers and the hospitals are free. So you just go, you will get the services. That is why you find that a mother goes to a hospital to deliver barehanded without anything, expecting all services, gloves and whatever will be found at what? At the hospital. Reaching there, she's asked to bring the
mama kit.
The mama kit. The mama kit. She doesn't have. And that is why when the person attending to her tells her, we don't have gloves, we don't have what, the first thing she will do is to call the councillor or an MP that it is you who told us that the services at the hospital are free. But now these people are asking for money. Now what do I do? And then the councillor will also raise the doctor or a midwife that, why are you asking for money? So that is at times where the confusion comes from.
Yes, but then in that confusion, which for now I'll get tempted to call our beautiful confusion, what is our role? Now, besides the fact that we can write a story, I think this is when we start doing our media advocacy. Because the truth is this: if we've investigated and we've discovered the facts, that despite the fact that yes, government says services are supposed to be for free, yes, medical facilities, government facilities are supposed to have the drugs, yes, okay, and the service providers are supposed to give us this quality of care. Let's be candid and ask and cross-check the reality. Yeah. Because if I go to a health center and I talk to the in-charge about the reality of what they go through, like I said earlier, I'll get my facts. And then I'll look at the patient to service provider ratio and realize that actually our hospitals are overwhelmed, okay? Yes. I'll get those facts as well. Then I'll ask the in-charge, how do you get the supplies? Because I'm sure NMS gives you gloves and whatever. When do they come in? Why is it that they run out? They'll explain to you because there is no harm there. Now, if you use your platform as a media person, be it radio, be it the papers or whatever, to target those communities and to talk to them, be candid. Tell them, ladies and gentlemen, politicians come and tell you ABC, but this is our reality. Services in this general hospital are provided, yes, but let's be honest. Our nurses and doctors are overwhelmed because we are many. Be candid, because you're speaking facts. And you tell them, according to the facts we have, Iganga Hospital has so many midwives. But how many mothers go through that labor ward every day? My advice to you, and this has nothing to do with politics or anything, if you're a mother and you're expecting, please plan and buy that pair of gloves. And then appeal to the community and you tell them, it doesn't cost you a lot of money. Because everyone seems to talk about free things, government things, but where does our society get? You've all seen the issue regarding education. For how many decades have we talked about cost sharing? And we're always saying, why is it that parents don't co-share? Everyone is like, no, children should not pay, parents should not pay for school fees. And we are saying, okay, why can't they at least pay for some money to ensure that the kids go to school and they have a meal, food, because that's very important. Which child is going to study and be comfortable in a class when they are hungry? Even as adults, we know we can't go without food. It's a basic thing to understand. But always the politics meddles in. So I ask you, ladies and gentlemen, who has the responsibility to sensitize our community? To think beyond the political facades? So me, as a media person, I play my role. I tell you these are the facts. Now, when you go to that hospital and you find gloves, thank God. Okay? But if you go to that hospital without that basic bare minimum, don't blame people. Start by blaming yourself because I've told you. Okay? Then at least let the people stand up and rise and say, we can't even afford a pair of gloves. What that says is, they now know. But they are saying we can't afford it. But at least they do what? They know. And they're not going to go to that hospital to castigate the doctor. That's why I keep telling you, for me, if you tell me that all our hospitals, when you go there, they are not service providers. The hospital, there was a hospital that they talked about when we were in your area, where they say that it closes on certain days when you go there. Yeah. You remember that hospital? Yes. Now that for me was so strange. They have a hospital, they said, it closes on which days?
It is Health Center 3.
Uh-huh.
Now when it comes on weekends, they don't.
And when does the weekend start for them?
So that is Friday.
Friday.
Evening. The mothers said that these midwives solicit money from them.
If they are to give a service?
If they are to give a service.
On weekends?
No. Wherever you go in.
Okay.
And they said that they are now shifting from Health Center 3 going to using Health Center 2.
Okay.
Because Health Center 2 does not ask for much money, because the other one is for the diocese.
Okay.
So it charges money, but not much money. So for them,
it's private, not for profit. So it's not a government facility.
No.
Okay.
For them, they say we rather go to Health Center 2 rather than going where to Health Center 3. But now, my fear is, I think referrals are supposed to be from down to up. But now, when it begins now coming from up
to down,
then it shows me that some of these mothers have started now going back to use the traditional birth attendants.
Exactly.
So we are likely to get problems if that problem is not solved.
Okay. So, but maybe I just want to stop here, but I wanted to say that from what Dr. Lukoda ably gave us and the information that he was sharing, it's supposed to even arm us more to become more curious. For me, the central point in my submission was, how curious can we be? How more deep can we go? But with an intention, okay? And I hope not only because we are looking for juicy stories. Yes, juicy, but we are trying to interrogate and say, how can we build an agenda that can get people really concerned, interested, hooked, and they want to engage to find a solution? Because that's our ultimate work. That's our ultimate goal. Yes.
In a simple submission on your issue, I think some 4 months back was in the Ginger Main Hospital. The patients were complaining. Actually, it was about delivery. That they were hiding some gloves which were supposed to be used for helping the mother to give birth and so on. So some few members had got some information that it is true. There is a certain doctor who cooperates with a certain outside facility and he sells those gloves. So we went there, the security this and so on and so on, and we entered a store where they kept those gloves. From there, then they take them maybe outside. Yet there are some patients who will try, they wanted help, but they can only tell you, rush to the nearby clinic there
and you buy a pair of
them. So it is you taught us about the simple area. Are you denying that, not all of them, but are you denying that there are some doctors or nurses or health workers who hide those things? Medicine, they give because they want to get some money and they tell you, no, medicine offer, you can buy.
No, absolutely. We've seen so many cases proved that way. So we are not denying that. We are not denying.
So that's
but
the reality.
That's also another reality. You know, when you talk about people who hold government medicines and sell them, which is illegal, and actually, in the eyes of society, honestly, it's very...
Another thing for Dr. Kakumen's, the reality is, goes back to the HMIs for people at the facility. Because those are the guys who budget for the facility, the ones who order when they are making reports, because I know in reports there's that option for drugs. Option for? Well, order for drugs, the medical professional knows that. They order for drugs. So
the essential medicines list.
Yes, the order it, the facility will go out of store. So that's the reality.
But they order for less.
Maybe let's first hear from doctor. Let's first hear from doctor and then we'll come back.
But when something like that happens, the fact is that people are saving drugs. Probably as journalists, we will find out what is that that gives them a chance to sell what? Drugs. I'll give you an example. When I was running so many years ago,
But the next campaign, I think that was the first time this egg and whatever. They removed the bush there. Then the shortage is again one.
Rose. Yet it was only 5,000 everybody was paying, and you could hardly tell anyone you go to one area and buy it. So maybe these are things, you know, when you create a gap, you create an opportunity for other people.
Yeah.
Yes.
Sir, you told us that we do tell the community that what condition telling is false information.
Not in that way that they are lying. You remember what I said earlier on? No. Let me clarify that. Let's not sensationalize.
Yeah.
What I said is stick to the facts.
Yeah.
If you've gone to the community and you tell them according to the information that I've received, I've analyzed the information of the drugs that come in this hospital for the last 1 year, and the numbers that they receive in the hospital, these medicines are simply not enough. My advice to you is, if you're going to such a hospital and you're a mother, plan and buy your mama kit. You'll find the service providers there. And you just leave it at that.
Then we should not mention about politicians. But
You don't have to.
But if we try to mention about the politicians,
No, but I also wanted to share a
Right.
bit, without sounding interrupt you. I think you didn't attend the orientation, did you? The orientation. Because
The online.
The online. Because we also talked about tone management, and you're able to say the same information, but the tone. Because you're still able to say that Uganda has 5,000 women delivering a year. In a month, there are 20 mothers or 30 mothers that deliver. However, according to maybe the medical officer or the whatever, they are given a supply of 15 gloves per hospital per week or per day. This does not actually tally with the number of mothers who
deliver.
This means that the chances of mothers, or there's been many occasions when mothers have come to hospital and the gloves had run out. So it is safer it is highly recommended that mothers. It's how you manage the tone, because first of all you've given facts and you're not quarreling, but you're stating facts. So even these politicians will not, even if they try, they may attack you, but you've leveled the ground and made it difficult for them to come and say that it's a personal attack. So tone is also very important. But anyway, these are some of the things we're going to do.
Anyone else? We have about, let me check. We have about 5 minutes, because then Sarah takes on the next, this gentleman and then this side. Go ahead, please.
This government facility human space. Because like in Masini, our main hospital was built in 1929 as a dispenser. And it was supposed to serve 50,000 people. Right now we're about 370,000. The same hospital has never been expanded. In the same state. The population is growing. And right now, there have been, due to too much congestion in the maternity ward, we have been compelled to use the male ward as a maternity ward. And right now, the women are sharing the ward with the men as they are speaking, because there is no space. It has remained the same. The leaders have tried, but we don't know where the problem is. They are not getting a new hospital. So that is the situation on the ground.
You know what I find fascinating is that every time you guys talk, for me, I see angles.
Very interesting angles. I can tell you that same, and hold on to that issue, because at least I would love to see that the Media Lab can talk about these never-changing structures in tandem with the rising population and the growth. Who here can talk about health facilities that have expanded? Especially if they are not private, not for profit. Do you know what those are? Private, not for profit.
Yes,
PNFPs.
But they're not even there.
They are there.
They are
Come
there.
on.
They are there.
What's his name?
Chemical Ali.
Chemical Ali. That's a sweeping statement.
Even mine.
Joseph,
Not for profit.
When I say private,
And someone delivers and charging 6 million.
Now you're confusing. Your statement was there, not even there. That's when I stopped you. Now you're talking of something completely different. So which is which?
maybe you could say they don't operate like.
Exactly. And the thing is, Ali, listen, seriously, the thing is, this is when we get into problems.
Yeah.
When we say private, not for profit, these hospitals understand them. They are private, but whatever services they give, they are not meant to make a profit.
Yeah,
so when you go there, and in a government facility, let's compare charges. In a government facility, they charge you 100,000 when you went and had your wife deliver. And you go to the private not-for-profit, the likes of Unsambia, Namirembe Hospital, Rubaga Hospital, so many, including even in Nagalama, wherever, Hoima, those Lacho, those hospitals. And they charged you 2 million shillings. Maybe ask them, why are you charging for this kind of money? Okay? But for them, ideally, the idea is we use all the money for the services that we offer. So when you...
Time is the pricing and so on.
But I would also like to feel that we are not the appropriate people to answer that, but it's also an appropriate conversation.
You could go and ask actually. You could go and ask. And it wouldn't hurt.
Yeah.
You'd ask them, look, if I can get this service, now I'm thinking as a journalist, if I can get this service in a certain facility at this price, why is it that you people now we are talking private, not for profit, but then we have those ones private for profit. Go to Nakasero Hospital, go to those others, the international hospitals and whatever, they will also charge different charges. So when you go and you ask them, it's a fair question, that your bill is at this. Can you please explain that? Because those people will tell you, and this is where sometimes you find these double standards, and that's why, guys, you need to appreciate why when I go back to the government facilities, and say, for me, the doctors there and the nurses and the midwives, I call them heroes. Do you know why? I know of a doctor, when they go to a theater, their fee will be 2.5, 3 million in one of these hospitals we are talking about. The moment he enters, do you know why? He's a specialist. So the moment he comes in and performs a procedure or provides a service, goes into theater, there is a standard charge. Their hospitals, when you use their theaters, the cost of that theater is standard. So you will go to a certain hospital and their cost of theater, you being entered into that theater, accrues a fee of, say, 500 or 700,000. Yet there is a theater in a government facility where you don't pay anything. But when they come down and they say, but buy the medicine, and a lot of things go on. Because we are entitled to a free service, we are citizens. You understand? So these dynamics you have to appreciate. So the private not-for-profit, when they are charging their charges, they will tell you that all these are running costs, including paying their salaries to their doctors and whoever. So if a nurse in a private not-for-profit earns $1.5 million, okay, it could be different from a government facility. It could be different from a clinic. It would be different everywhere. These dynamics are there. But if you want to find out why these charges are categorized the way they are, I think it's fair. When you go there, you would find someone to give you the explanations and the answers. Maybe not 100%, but they can defend their charges, you know? And let's not forget, we live in a free market economy. In Uganda, where prices are levied on things and no one comes to your rescue, you know? But going back to the point you raised about structures that don't change in tandem to the population and the development and whatever, again, that's our reality. But for me, that's a very interesting angle to investigate and to expose to people, you know?
Exactly. This gentleman had something to
I
say.
just wanted to inquire from the doctor.
Yes.
Doctor, if for example I take my wife to the hospital and she gives birth, and afterwards I give that doctor some money out of appreciation, is that also right?
No. It's an appreciation.
It's an appreciation. If Jimmy, you say, doctor, thank you for what?
Even if he's here and I come and
But also when you're giving an appreciation, why would you want to make
For
it a
everybody to
showcase?
see.
Why does it become a publication?
You may be excited.
Well, then that becomes a matter of also how the health worker handles, because the health worker might say, thank you, I don't do it. I did a service.
In hindsight, everyone would appreciate to be, by the way, it's one of the greatest rewards. It may not even be money. And that is why when we were talking to some of the leaders in the districts during validations, I asked the politicians, because they would always be in the room with the service providers, and I asked them, how many of you in the last 3, 4, 5 months have gone to these health centers just to say, I've come here to see how you work and to check on you and to say thank you very much for the service that you provide to all the Ugandans. And the room was empty. But that alone changes a lot. And they don't even do that. What does it take? Only your time to go there and say thank you. But when we were listening to the feedback coming from the health center service providers, I mean, we appreciate our problems and we know how to juggle between the biggest people who've given us headache and have brought problems, politicians. They come into our work, they interfere, they do this and that and the other. It can be a blame game. Because sometimes when you listen to politicians, they also have a point of reference which makes sense. What I'm trying to say is this, that when you talk about appreciation, as much as it can be a good thing, it can also kind of breed certain kinds of contempt and what. Because we live in a fluid society and like people might even misunderstand what you're doing. You know, the doctor might be seen in a bad light. In any case, when you said thank you very much, doctor, and you gave him a token of appreciation in that envelope, are you assuming he's going to share it with the other people who helped him? Because the service that a doctor provides is dependent upon so many people he works with. You know, you'll find a health center in charge, or you'll find the head of midwifery, who on a lucky day can spend a week without entering the labor ward. But there are people in there working and they are all under that person's supervision. Okay? Meaning they are working. So when you say thank you very much, doctor, because you stood in a corridor, what about that midwife somewhere who actually gave the service? I'm not saying that this to kind of undermine what you're saying. I'm just saying the dynamics to so bring the other issue that maybe when you choose to do that, you might want to do it discreetly. Because other people might say, hey, others we don't matter, that kind of thing. A lot of dynamics, but otherwise I would say generally, why not? When someone has done a good job, appreciate them in the best way you can, by all means, but balance the boat.
This is before the service. I mean, not before the service.
Yeah, not before the service.
The handshake is there.
Yeah. But also the word thank you, like Herbert is saying, and I have noticed that strangely you might give someone money and they don't appreciate it as someone who got, especially if it has nothing to do with your issue there. And you just can say, thank you, you guys are doing awesome work. My name is Yosam. My name is Asha, all of you. I am a journalist, I cover for this. I just wanted to come and say thank you. The stories we are getting from people, yes, there are challenges, but you're doing awesome work. I promise you that will even promote people, because like when I'm going up country, I used to drive to Karamoja, Kasese, where I just put a box of water, like all boxes of water in the car, and they don't even stop me. But when I stop, I greet them. You know, these guys are also bad, but they are also good. And if you have traveled in Kenya, Tanzania, because I've driven through Kenya, through Tanzania, those guys are actually good. You are guilty before them. And even people who are not Ugandans will tell you, Ugandans are corrupt, but those people are human. Someone will take your money and you give it there willingly, they treat you well, they even say safe journey, they first greet you, and when you explain that you don't have money, they would even let you go. A Tanzanian officer will put you in. So for me, I don't want like to give them money, but I make it a habit to stop and just chat with them and give them water. And let me tell you, it is amazing how they appreciate the fact that you talk to them. You stop, because they'll say go, and you say, no, I just stopped to give you water. Isn't it hot?
You're talking about traffic officers?
Traffic officers. And I mean this for everybody, even if it's a health worker. And I know that I have done a favor to the next 5 drivers coming. Because I've left this guy in a fantastic mood. And it doesn't have to be only cash.
Exactly.
Yeah, I just wanted to share, because I've seen it, even if you go to teachers, like at school, and you say, hey, you're doing well, children are telling, even if it's not teachers of your actual child. It's amazing how they appreciate that more than money. Try it.
What actually Sarah is saying is that, you know, when we talk about the service providers and the challenges and the like, if we find good angles where we can write stories of empathy that appreciate what they go through, and that despite the fact that they continue to provide services, let's write it with that color, with that tone, and let's make them understand that we see what they do and we see them for who they really are. That changes everything. Otherwise, sometimes we find people and we just take the face value that they are rude, but you're talking about people who are really tired, fatigued, and extremely, extremely frustrated, you know? Yes.
What you're saying is bring forward this one. There's an accident that happened in the same yesterday. So a frequent sport in a lorry which was carrying 20 cars. But by the moment I was actually almost the only person the scene, the hospital. So the moment I entered there, it was so much congested that the numbers were big. But what I did first with my camera, I went to where the doctor was, as soon as one was like, hey, you're doing a very good job, but I want to assure you, the speed that I found which was there was almost times 100. Now you're moving around, sure. Now, actually, one of the doctors asked me, you returns from where? Because I think they want to recognize me. But what I want people to do is, what they need to talk about, and they just want to come back for you to about money. There's a situation like I'm moving from here one city to the other, but there's nothing I can give this person here. Can't I advise him something like, we're talking about conversation very serious, not a future, the patient is bleeding, and I'm like, hey, what do we put your voice has to get the injection and whatever it is. I think that.
No, you can.
Maybe they will go into
There's always that risk, but
normally, like I'm seeing the way you're moving, looking for the injection.
Someone may think this one is trying now bribe me. It's better because when someone comes, that's
But you may be interested in maybe you appreciate and you do something much, much better.
I don't know.
no, it's really a tricky situation, and I don't know. By the way, I don't know why we are somehow stuck on this thing, but we just, for me, I would say we just need to be really extremely careful so that whatever we do, we don't end up compromising the stand of this service provider, because ideally they took an oath to provide this service regardless. But it doesn't hurt for you to say thank you, but say so in an appropriate way. I think to catch a doctor when they are doing their rounds and then you are giving them money and what would really put them in a very, very, very precarious situation. Actually, even if they never ask for this money, you might leave them with a problem of explaining that for a year or so. Because do you know what they are going to hear? Not your good words. Those are the statements you'll hear somewhere up at the district, wherever, and this man will spend eternity explaining.
That one helps us maintenance.
Yes. But not in a way that puts them into, for example, if you're busy, if I find the doctor busy, but I know I want to pass on this car token to them, be prepared. Have an envelope somewhere, you put your thing in your envelope, leave it with one of the trusted nurses over there. This message is for Dr. So-and-so. My number is in there, but he's going to call me. Era Dr. Bwana Sangamu, Ashraf yandekedemu emitwalo ebiri with my number. Doctor agenda kuba because he wants to know. I don't have any transaction. Mwami Ashraf, you left me with money and yeah, I just wanted to say thank you, doctor. I came, but when you are so busy, I'm from so and so, it will have the same effect. Actually, that will even be more interesting. They will be curious to meet you the next time. So next time when are you passing around? When you come, please stop and say hello. Cultivating, yes. People are just going to get confused and they are going to misunderstand both of you.
And the social media will be taking.
Actually, your journalist friends will be the first to write about you. Era mukwano gwenye ajja kubuuza in these words. Chicho wabadde oyisaawo. I don't understand you. Search tegere because it's strange.
Hey, doctor, I said if he's making way.
Yes, he wants to run.
Doctor, thank you so. Yeah, it's been educated, enlightened, and it's been very, a bit cozy to use that, but very friendly.
Yes.
Comradely, like, so we appreciate how. Made us run away. Thank you so much. We really appreciate it. I know that our path will definitely cross, and we look forward to interacting with you. And I hope we get a soft copy of your presentation so that they can now refer to it.
It's already with you.
Yeah, thank you very much. So we'll share the soft copy. And again, thank you very much. And yeah, travel safely and looking forward to further interactions. Yes, and before I start saying anything, I was thinking of probably doing a bit of exercises, but I'll show you a short film. Then we can do exercises later. So we have a number of films and we wanted to show them, but we also know we don't have time. So for those of you who might want to watch some of the short films that we've worked on, we could do that later. The people who may go home might probably miss them. I don't know. Alan, are we good to go with some of those short films, or should we, the skits, or do we just go for like Hear Me Too or something like that? Are you good to go with the short skits? Right? Yeah? So we wanted to show you, because we've actually been, I'm glad White Ribbon Alliance actually realized that there is a connection between Native Voices and White Ribbon Alliance, because we've already been doing this kind of work. We have a number of videos that we'll show you, but the video you see, I think we'll have to start it again, because we told you, can you kindly pause so we can introduce and start afresh? So there were people who were training. I see Chemical Ali is looking at it like I know this video. So when we do trainings, some of the things we do, the people have to do short films so that we see or establish have they actually got the training, because it's like in 3 weeks or 1 month. So they get into groups of 4 or 5 people. And one of the, we usually also get people who are differently abled. So one of the people we had during that training was a deaf person. And one of the stories we wanted to tell was the challenges people experience, especially the ones who are deaf. And there was someone called Alex Laoko, who is the boss to the head of the organization, where the one who did this works. He did a study on the challenges of differently abled people when they go to deliver across Uganda, and he was supposed to present it, but we've kept changing dates, and he had to travel to Gulu, so he's not able to do it. We shall do it online in future. But Josephine at that time was training, and she's one of the celebs in the video. And enjoy it. It's ideally I wouldn't want to show the whole video, but I think we can get away with doing that. How many minutes? 11 minutes. I think we can do 11, but we also have a number of short videos on the different subjects that we are going to be talking about. Let's start with that. Why? Because Alex is not here, and Alex was supposed to be facilitating this. It will not cover his study, but it will give us, it will at least provoke us to think in that direction. What happens to people who are differently abled, and the things that we are talking about, sign language and a number of things. Yeah. So Alan, we are ready when you are.
Between the deaf and the hearing people is a big problem in Uganda today. The deaf highly depend on sign language, and yet most people are not exposed to sign language. Communication thus becomes so hard, leaving the deaf in a dilemma, thinking of what to do next. We thus made a follow-up of some deaf people and interviewed them about their experiences when they go to seek for health services. We started with a lady by the name of Esther, who lives in Mitinda, located in Kampala, Central Uganda. Esther is a mother of 3 children who are actually not deaf. She has gone to hospital for antenatal care and delivery for all her 3 children. But Esther explains that communication between her and the health practitioner is worse when it comes to sign language. They cannot understand her, neither can she understand them. This becomes a challenge to her, as she says.
My name is Esther. When I didn't start from home, I've always gone to hospital. I have gone to 2 hospitals so far. The first hospital I went to was Glenwood Hospital. Mulabo Hospital was the second hospital I went to. I've always gone to these hospitals whenever I'm 3 months pregnant to find out the situation of my babies, to find out whether they're actually fine or there are any challenges. But whenever I could go to these hospitals, there was one challenge, communication challenges, because the nurses of these hospitals, they don't know sign language.
Reaching at Kiswa Health Center was another step we took. We were able to hear from some nurses and midwives who work in this hospital. I'm called Nanta Joan. I'm a midwife. I work here at Kiswa Health Center. and I'm working in antenatal currently. So we normally get these mothers, but sometimes they come with someone from the community to introduce them to you, but some come on their own. So when they come, some know how to write, so we can communicate to them through writing. You write what you want to ask, and then they answer through writing. Some we use sign language, they don't know how to write, but of course our sign language is not that best, because we've never gone through that.
So once I was at hospital, I actually sat for a long time. Then after some time, I decided to use a sheet of paper that I had to communicate what my problem was. So we exchanged a few tips with the doctor, who told me to wait for a long time.
We were also able to talk to Sevata Julius, who works at Uganda School for the Deaf, found in Tinda as the school carpenter. He is a deaf man, and he has been able to take us through his experience as he goes to seek for health services in hospitals.
So when I go to hospital alone, it's very challenging for me to communicate with the doctors. You know, sometimes explaining the pain you're feeling is very hard. And sometimes when they write, their English is very complicated for me to understand. And so normally what I normally use is local gestures. So I point my touch where I feel the pain. If it is headache, I will touch my head. So sometimes the doctor will also point where the pharmacy is. But the doctors also write, their handwriting is very hard, and it's hard for me to read that English. So what I think is important is to study sign language. So sometimes if I go to hospital, I need to get a sign language interpreter, and that is very expensive. But remember, we don't have money. We don't have money. So I wish the hospital can actually adjust in that to put the fees with sign language interpreter.
Thank you. I'm Sate Sarah, a midwife working with Kiswa Health Center, currently in antenatal. But at least even in maternity we've met them. In antenatal it might be a bit easier, because most times they come with someone who can translate to us. Sometimes they use gestures that maybe we can guess what they are trying to mean. But when it comes to the real sign language, most times we are off. So we try to guess the gestures. We use gestures to ask what we want to know, like asking the complaints they have. Sometimes we write. If someone comes alone, she doesn't know how to talk, we write, asking questions, and they write as they answer. But when we go to labor suit, whew, it's tough.
You know, when some of them actually came and realized I was deaf, some decided to hide. You know, they will tell you we are coming, they go, they don't come back. But there's this particular one whom I wrote to on a piece of paper, and that's the one we actually used to communicate. And so they could refer to the file, you know, they could write on the file to tell me what is going on, because, you know, the hospital is normally crowded with a lot of people. And so whenever they could announce names, you know, I couldn't hear, so I couldn't understand anything, and I had no interpreter, so I actually got stuck.
According to the challenges faced by the deaf, Esther and Julius feel that something should be done as far as sign language is concerned. by this, they think the government should intervene and help to put an end to these challenges.
I personally think if there are enough resources there, then the government should carry out trainings for both doctors and nurses in sign language. This would ease the communication for deaf people. Or announcements should be done. So whoever is interested in undertaking sign language should come for training. We have such trainings at UNAND.
Okay, first and foremost, it's okay for every health practitioner. Or at times,
what has happened? It's here. It's in the laptop. No. Maybe the way it was uploaded, because we've had it. I don't know. I'm sorry that we can't complete it. Maybe later. But two things. One, it was a training video, and I remember we didn't have sound issues that we could not hear, but we had sound issues that they had gone with the camera and used natural sound. So the sound was bad, and we had asked the filmmaker, Charles, who you've not seen but could have seen at the end, to redo the film. And I think he had finished training and he didn't want to come back to do the film again. But he raises some pertinent issues, and I feel that maybe if we had also had, or when we hear Alex, his boss, giving us his study, I think it is something that is very important for us to look into, and I think it's it gives us some themes. Those are some of the themes that we may be looking at.
An interpreter is appointed to offer any service, then it will be free of charge. And then the database will also be created for all deaf people in the country. And whenever a deaf person goes to access services, then the services should be offered free of charge. You know, the challenge we have is most deaf people out there face a lot of challenges without any solution. And so they get a lot of barriers.
Recommendation would be maybe they train health workers who come into contact with these people. At least if we can know how to communicate, service delivery will be easier to us and to them. They will receive their best, and we shall understand each other. Sometimes we try to give the best, but due to miscommunication, someone sees as if she was not cared for and will go when she's not satisfied. But if we are trained, I think it will make a difference. Charles Ojok, a deaf brilliant young man currently working in the Uganda Center for Sign Language Bible Translation Network, until now feels he's not satisfied with the suggested solutions in the told stories. He says an app should be developed and launched that contains a number of signs and gestures as shown below. He feels that this will actually bridge the gap between the deaf and the hearing people in terms of communication. According to his research, he says that this will actually reduce on the increasing rate of maternal deaths that occur in the deaf community due to the barriers in communication. Ojok therefore calls upon the government of Uganda, the non-government organizations, and any other interested stakeholders to take part in the building of this app.
Okay, thank you very much. So we have also seen Josephine's acting skills. Thank you very much. So I feel that he also came up with an interesting solution of an app online where people can, if they don't have deaf people, go and interpret sign language. But I think that is not why we are here today. But
for me, it looks at, Dave, what about the people who are disabled? What about people who are blind? What about all those questions? So maybe those are things to look at. I think I'd like to go straight to this discussion, and I would like to, because I was supposed to talk about editing, narratives, and everything, but at the same time, I'm also supposed to talk about the media and why we work with the media. And I pinched a bit in the morning. I'll do my best to rush through. I can see that there are people here who had a long day yesterday, traveled later, especially the people who traveled late. So maybe this should have been an appropriate time for them to take a nap. I will try my best to hurry because I really understand that it's also been a long day. So we already went through why we need media coverage, but I just want to emphasize, and this is not me being very clever because it's not my presentation, but I've picked from studies, and what I would try to do is domesticate it and share experiences. Otherwise, it's not my study, it's other people who came up with RMC and developed a study on the media partnerships. As native, I'm just domesticating it and relating it to our reality. So we know that media coverage of maternity care, if there is sensitive, accurate, then women and their newborns and care providers stand to benefit greatly. It means that journalists can be key partners in spreading the message to every woman that they have a right to quality treatment, to respectful treatment. But it means that also journalists themselves have to understand what is that respectful treatment. That is why you see we put the charter. And that charter, although you would domesticate it to your reality, everyone, I don't know if Zahara got a copy of the file, but the file, if you meet Christine, there's a bit of a charter, and that's not enough. There's more literature you people can find online, but that should give you a bit of guidance, plus probably the doctor's study. And it also puts a lot of responsibility on us, because if as journalists we just sensationalize and say, not that we should keep quiet, that hospital, they kill women. Women have been dying in that hospital. We also risk exposing women to further death. Why? Because they will say when we go to that hospital, we will die. But they will die, but then they will also die when they don't get health care. So those are some of the things that we need to understand. So there is an issue of the landscape in which we work in, because the media works in different places, and there are challenges that you have been talking about. It's the old-time issue, because, for instance, USAID, how are you going to tell them that we had to pay journalists to go and do stories? First of all, and that is something we have been emphasizing, when we are doing these stories, first of all, we know that it is our role as journalists, because journalism is a service. I went to my former school about a week ago, I think, maybe, this week, I think on Monday. And I met a teacher, actually, he came to teach after I had left. And he was saying journalism has benefits, but you have to be patient. Because journalism is not a thing you come to get rich quickly. That might not happen. But journalism exposes you to a number of things. For me, personally, there are things journalism has exposed me to, like the travels, the people that I know. It has also exposed me to bad things, like I know my rights too much for my own good, that sometimes I get in trouble with the law people and all that. So that is also the bad and good side of it. But I've been able to also defend many people because of knowing my rights. So on these projects, it's like the journalism. If you came to this project because you see it as another way to make money, a quick buck, maybe you're in the wrong place, because probably that may not happen. But we are also working and cognizant of our situation, where you have a media house that probably has only 2 advertisers if it's a radio station. And it's depending on advertisers to pay workers. And as someone noted here, some of the media houses have stopped employing professionals who are going to demand for pay because everyone now can do what? Tell a story. So if you expect that journalist to leave, for instance, Mayuge, we have someone from Mayuge here, and go deep to Wiende to get a story, and they will not, even if they love to, because the media house cannot invest. The person themselves cannot go there. And even when the media house invests, there are no chances that they are going to recoup that money. And that's something Herbert earlier talked about. Print media is in trouble. We've just been doing a documentary, and one of the people we're awarding is, we are not awarding, but profiling for the people awarding, is a news vendor. And before, newspapers depended on sales. And today, a newspaper, and that's what Herbert said, that how differently are you saying? Because something that has happened now, someone has put it out. So if someone has put it out, how can you go and start reporting the same story the following day? But for a newspaper person, you have to probably send a photographer, there has to be print, the newspaper has to be printed, the kind of money that goes in, if it's not equipped. So, okay, let's first do an exercise. I see people dozing a bit. Okay? We are going to do an exercise. Okay. I know, but there are others who are dozing, and I don't blame them. So are we going to get some music, or we are going to dance by ourselves? Okay, let us also get rid of the clothes. One of our colleagues just died, right? Because of our clothes. For sitting in one place, right? Can we stretch? And when you stretch, don't do sounds. Because we can't laugh. Okay, so let us go. In those stretches, I told you I'm staring 5th floor in the face. But I can do these, and these, and these. The people who have short skirts, at least for me, there is only this one seeing. So we do 2, 3, 4, 5 this side, and then we do 2, 3, 4, 5 this side, right? 1, 2, 3, here we go. 1, 2, 3. Oh, I know, even me, I'm having trouble here. Then we do the other side, okay? 2. Hey, what are you doing? Maybe I see you breathe. Okay, you're breathing. 3, 4, 5. Okay, make. Did you play that game? You say make it, okay? And the one who make it as the wrong things will have to either sit down, and for us we continue, or make. Nyama ya mbwa. Make. P1G. Oh, one more Muslims to Jirekeyo. Make. Akamiu. Mbwa. Okay, make. Demayambuzi. Akamiu. Sekoko. Kappa. Okay, I think that has woken us up a bit, okay? Thank you very much. Let's continue. Explained, USAID, who is our partner, wants us to facilitate people, but does not expect that we are going to pay for stories. However, they understand that there are people who will need transport to go to certain places, but they did not give us a lot of money to cover that. So I'm not saying don't do stories, but don't get ambitious, yeah? Don't come from Masindi and probably decide that in Kasese they have an issue, we need to go, or I need a board of 20,000. Maybe the money might not be there, but maybe when you pitch and that story is critical that we must do it, we do what? We do it. So that is a bit of the facilitation that might be available, but we also know that people also sometimes work and they don't get paid. So we don't want to call this payment, and we are not going to be expected to do payment, but we are going to have what we'll discuss tomorrow, of when we have discussed the themes that we are going to do. A week, each week, we'll have themes. And we will not tell people that don't do your other story because there is this story. Because at the end of the day, you still work for your media houses that expect you to do other stories, not only respectful maternity care. But if you can share with us that story, and maybe we take it as a tip, or you can do it, or we can help you do it by contacting some people we know, then share it. But also, we may not be able to cover all the stories about respectful maternity care that you're going to do. At the end of the day, you're a media practitioner, so you might do stories that are not covered by Native, but your community is going to benefit from them. So maybe we can do an extra story, but the way we programmed this is at least we expect a story a week from a region, or at least 2 or 3 stories a week, depending, because we know, and it's not because we feel the TV person is more than the print person, but there are dynamics of probably a TV person goes with a camera person and whatever, and probably there's a little more incentive in terms of how they travel with the equipment and whatever. But that does not mean that the person who is doing radio is less, but that was the nature of the thing, that the provision differ. But if someone of radio, even if the provisions differ, is going to have to do a border that takes them a certain distance, and please don't say I went there and I did not, and yet you did not go there, then that's something we can look into. That's why we said, how do you work with Native? We have this WhatsApp group. Someone asked if we will be on WhatsApp group where you can share stories, but we're also going to have weekly conversations a bit where you share what you would like to do and we discuss, but also where you share things in line with the theme. So yeah, we will facilitate, we will explain to you how much we pay per story, and it's not pay. So the word I'm using is wrong, but how we facilitate, because we are not supposed to pay. A lot of you people in this room, you're here because when we came to you and requested, can you kindly have this? Because you know you're many, you're about 40 or whatever that we have contacted. There are some who said, where's my money? If you don't have money, it's a project, it's organization, it's you said we don't want to work unless you don't pay us. We say, wait a minute, what is this? Because we don't even have that. We are not even allowed. Then there are people, all of you who are here, but there are people who say, you go, because we were saying, you know, for us, we need to also give feedback to, if we say we facilitated a story, we need to give. Then there are people who say, don't worry, you go when the story runs, we shall. Then there are others who say, what shall I tell the editor, even though I have to facilitate the editor, and up to now, even when they say, okay, let's give you a small percentage, up to now they haven't run. And there are others who haven't run, and they've gotten back to us and say, you know what, the editor has refused, or it's not running, or I don't know what. And we've all been journalists. Yeah. We know that you can write a story and the editor does what? Refuses, right? So those are some of the things we are also going to talk about later. But why am I sharing this? I'm sharing this to say that we have to account also, and we have been told no payment at all, but there was a case, and you have to understand that you said people do more studies than us. So when we were telling them, it's not like they didn't know. They knew that the conditions of journalists in this country, but also then they have people, Herbert just told you that they're what? Taxpayers' money. They have people they account to. They are not going to tell people, we paid journalists to tell stories about people in their communities to promote safety of mothers, some of them their mothers or sisters or wives. Do you understand? So it's a very thin line to navigate, but it has to be navigated. So that's what they call understanding your landscape, especially if you're working with journalists. So later we'll be discussing, okay, what is it? So we were supposed to look at the overview of the current state of the global maternal health and rights, and we already talked about it, and where we said, okay, about 70% of maternal mortality rates or death could be avoided. They could be avoided, and of those 70%, 99% of them are in developing countries majorly being African countries. So why are they not avoided? Because of the abusive language, the way people are treated, the lack of access to health facilities. There's a documentary I wanted to share with you where we filmed people at an island where they have to walk like 22 miles to go to a health facility. We don't have time now, but later if you have time, you will watch it. I think we did it in 2012, but it's still relevant today. So the media then comes in, because when the media can expose some of those issues, some of them infrastructural, some of them because health workers are paid little money, some of them it's because health workers are working long hours, some of them are because even health workers are disrespected. I don't know if you have experienced that, but there are health workers, especially the midwives, who are put down. They are put down sometimes by fellow health workers because of the hierarchy, but sometimes they are put down by us, the patients themselves, saying you're nothing, you're just a mere nurse, and then you've come for treatment, or you're just a mere midwife. So we can also play a huge role in changing the mindsets and having people value health workers and treat them with respect by showing, for instance, what Herbert was telling us about, of someone saying that we also want to be cancelled. We were in Rubaga and someone said, but you're saying that, but there are women who come and we don't have, and we get on our personal money to buy gloves. So imagine a story of this woman, and the image we have of those midwives are these mean women. But there's this midwife you're portraying in society who actually goes out of the highway and gets her meager resources, and she shares them. So, permit me to go down a bit. So celebrating, which is what we are saying, like at Native we've celebrated many people. There is a doctor we celebrated at Mulago, because we also hold an annual Celebrating Womanhood Festival, but it doesn't mean we celebrate only men. We celebrate women. So we celebrate only women. We also celebrate men. That man is he's a neurosurgeon at Mulago called Dr. Muhumuza. I remember the story of Bobby Wine, when they said that the guy who had died had been killed and taken to hospital. And I said, if Dr. Muhumuza has written that report, that guy, the Bobby camp is not giving us full information. You understand, eh? Why? Because Dr. Muhumuza is that specialist who, wherever he works, is one of the few neurosurgeons we have. Wherever he walks into a ward or a private ward, he will be paid like 3 million and above. But he commits most of his time to serve the people at Mulago, where he is not paid highly, but service. So Dr. Muhumuza has a tendency of coming and saying, hey, kakati mbade njaga kukolako, but wankozeko. Then you say, hey, nakozeko na wadde musawo. I hope some of you understand Luganda. Na wadde musawo gundi. Ntinga bade tanatusa musawo chi. Oli musawo oli gundi, habati. Hey. When he goes back, nenga wampadde mmeka bannange ampadde bweziti nti ezo ndoza za mulala nze namuwadde 19 kale webali Habat omukyala muddize emitwalo gye 19 wano services ziri free and he will be sure that they don't mistreat you, they don't mishandle you, they don't do anything bad to you. Like he's that kind of a person. So there is no way Dr. Muhumuza, even if he's a munyankole, as people want to say, you understand? He was going to write a report saying that the guy had a problem and he hadn't. And then that's where journalism comes in. Because you see, we all know now that Andrew Mwenda works for the state, right? In as much as he's a wonderful journalist. But why Andrew Mwenda is still one of the best journalists and still beats many of us. Even when we were saying, Andrew, shut up, those people were killed, Andrew went on ground. And Andrew got all the facts. What time they got the accident, when they moved, who was there, who was the woman. And you know you could not contest the facts that Andrew presented. So we, like people who don't like Andrew grudgingly, because we are also on this journalist platform, grudgingly say, okay, you defend this because Andrew says this. Can you counter that fact? And people were not able to counter that fact. Again, facts. So Andrew might be verbose, might do whatever, but the one thing Andrew excels at is giving accurate information and facts, which is something that will be very important when we are doing this report. Then another thing is reputation. What did I say about Dr. Muhumuza? I said, if Dr. Muhumuza, there are times when Andrew says things that really annoy me, because really we know Andrew now works for the state. But we remember he used to be anti. So I really get annoyed, but I said, if Andrew has said this, let us investigate. And when you investigate, because you know Andrew is not going to be caught lying. So you understand? Yeah.
Just to clarify, she's talking about, remember recently this issue of Shiba?
Yeah.
When it happened, all of us, our tongues were wagging. Come on, Andrew. And Andrew came out, he said only one thing. If Shiba says, you say she says, I am the one who molested her or whatever, assaulted her, not molested, but assaulted her, let her come out and make that statement. I've never even... And he was so clear. The moment he said that statement, everyone knew, no, this is not Andrew.
Yes.
Okay, we want to know who is it. No one pointed fingers at Andrew. Because he will never say a statement and go back.
Yes.
And he was very clear. I'm not telling you, I don't know anything, but me, I'm telling you, it's not me. And he did not use those words that it's not me, it's not. He just said, if she says, otherwise, as far as I'm concerned, I've never met her. But if she said, and that is...
And by the way, Shiba herself didn't say it, but because people don't like Andrew Mwenda lately, they decided they were going to say it's Andrew Mwenda. So as we said, we are going to talk about some global figures. So we already said that globally there's been some improvements. And we said that as of 2012, so we need to check 70% of birth worldwide occurred with the presence of skilled birth attendant, 70%. But when you say skilled birth attendant, only 46% were overseen by skilled birth attendant in least developed countries, meaning that in least developed countries, we still haven't bridged the gap of going to a skilled birth attendants. And only 58% of women globally and have at least gone for antenatal visits. We are looking at our themes when we bring this. What is the relationship of antenatal visits to having safe deliveries? As journalists who are reporting and we are covering and we want to do themes, because when we are talking about themes, we said, why should we do themes? Because then, Herbert had told us, they amplify. If all of us this week, from Masindi, from where, it doesn't stop you from doing another story. But this week we are looking at antenatal visits. And it is all over social media, and it is in the print media, and it is in television, and it's on radio. People say, wait a minute, antenatal care, you mean it's important? Even the husbands will tell their wives, why haven't you gone for what? for antenatal. You understand? Because when you go for antenatal care, you're advised some of the things to do, the exercises, the meals. Do you know that even the kind of meals you take are responsible for the outcome of your child? So if you go and you probably do a scan, because a doctor can already feel the heart, and you do a scan, so they're able to tell that maybe this baby is not okay, or they need more blood, or the limbs are this and that, or we need to support that. But if you didn't, or this baby, the shape they are in, you will not be able to deliver safely, so come early and do whatever. So if you went and you knew that and you got to hospital earlier, how many deaths have we prevented? But how many women have gone for antenatal, even women in your homes, and have been able to do it routinely? But as reporters, how many times have we reported about the relevance of antenatal? Why don't women go? What are the cultural dynamics? How are they treated in hospital? What is it that stops them? Yeah? So an estimated 2.7 million neonatal deaths and 2.6 million stillbirths occur annually. They occur annually. Why? Because we have not been able to go for antenatal and probably trace some of the preventable issues, and probably some might not have been prevented anyway, but the situation is managed, including psychological, because sometimes it's the formation of the baby and all those kinds of things. So delivery with a skilled birth attendant decreases the risk of stillbirth due to complications by 20%. We've just discussed that if you have a skilled birth attendant tending to you, and even then, there are times, for instance, there's a lady who, a relative of mine, she was going to Chisenyi, and Chisenyi, they told her, no, your condition we cannot handle. You go to Kawempe. And she didn't have money if she went to Chisenyi. So it means even Kawempe is a government facility. But because she was going for antenatal, she was able to be told that you have these complications that we may not be able to handle. And the people, they knew her case even when she was delivering. They did not allow just anybody to handle her. It is the experts who handled her. So that's what, again, we mean when we say maternal antenatal. Then maternal mortality is the second leading cause of death for mothers between 19, I think. Kindly bear with me, because, yeah, it's between of ages 15 and 19. So when mothers between 15 and 19, when young girls between 15 and 19 die, yes, it could be an accident. Yes, it could be another ailment. But what they are saying, it is the second leading cause of death. Why? Because they are not yet ready, because they are trying to abort, because they are young children, so probably family planning. As journalists, if we are talking about respectful maternity care, we also get into, are you ready, consent for child give birth and all that. So we are looking at, when we are talking about this, we are already looking into tomorrow's themes, because you are also going to come up with the themes of some of the subjects that we may need to look at. Why do girls worldwide who die between the ages of 15 and 19, the deaths are connected to childbearing or maternity-related issues? Then the World Health Organization estimates that for every maternal mortality, 20 to 30 more women are afflicted with pregnancy-related morbidities, such as obstetric, fistula, or depression, which impair their functioning. So that goes into now again, the treatment, the post, the pre, but how many people, even when our mothers come to hospital, from hospital, or our wives or our sisters, have we looked at how these conditions may have affected them? Even the operation, there's a baby called Angel. I wish I had found the short film. This lady told the doctor that, you know what, I have issues. I am allergic to a certain drug. And funny, I found a similar story here and said, don't give me that. The doctor did not listen. So he said, for me, you can't do that because it affects me. They just went ahead because for them, they had to do a procedure, and that is the only thing that they knew. So they went ahead and did it. And now Angel is deaf, the baby that was born. But the mother is psychologically tortured. She has never recovered from that experience. But it all started from or by the health worker, the provider who was tending to her, not listening to just a basic message of I am allergic to this. So, in my opinion, did Angel's mom know her other rights? And this is someone who works for one of the organizations that are big time. So she's an educated woman. But did she know her rights, that her consent is important, that she can say no? Was she in a condition where she could say, can I have another health worker work on me? But what are the conditions when she chooses another health worker? We shall be seeing another video where health workers come in solidarity to support their own when like doctors or patients or politicians do what they think is interfering. So even as a journalist, how are you going to work so that these people don't think you're interfering and your work is appreciated while you seem to be also respecting their space and professionalism? They say that an estimated 3,000 women die annually due to childbirth-related diseases. But this is globally. But when I say globally, don't forget 99% of those are in third world countries. Then, so we all have a role to play. I don't want to go into that because I've heard that everybody, as like the previous presenters, Herbert handled that ably, and the doctor, and they also were able to connect it to how the media has a role to play, especially with giving accurate information, telling people, making them aware of their rights, but also the policies. And I don't know if you also know all the policies that are related to this and breaking them down and quoting them. And also they say media as activists. How do you sell your information? You see, of course, that's not only up to the media because they have their work and their platforms. But it doesn't stop you now as an activist, a journalist who is an activist, looking into ways you can pass information that you have. Like, have you done a story where another media house has not gotten it? I remember I used to do that a lot when I was still reporting. And I would do a story and maybe Observer. That time Observer was not active, but was not open, but Monitor. But the then editor of Monitor, Jetty, we had worked a bit in Crusader, does not have it, even Vision. I would give them the tip. Of course, television, I would also try to scoop and run it first, but I'd also give them the tip and see that they have further information. Because at that time, I think I was an activist without calling myself an activist, because I knew that that information would go and spread to more people. So if you do a story, and it runs in the Monitor or NTV or Observer or Baba TV or all the radio station or UBC, and you know that the people in Masindi, in Buyende, in Wea, in Iganga, in all the US may not be able to watch that story. What are some of the other channels or platforms? If you have time, because also as journalists, we are also chasing stories, we are chasing life, we want to earn a living. But if you have time, what other platforms might you share that story that you think can be helpful to other people? Like, that's how I hope that we will work, because if you're Sam or you do a story, any of us does a story, Native Voices is going to pick up that story. We'll put it on our platforms, respective platforms. That's why I also encourage you, do YouTube. But we are also working with other bloggers. We are working with people like Samir. We say there are stories that we've covered and we've forwarded to Samir and he has tweaked it or whatever, but so that that story does not stop where there, and now we are a network. So we hope that you're also able to spread. Maybe your radio station might say no, but the WhatsApp groups in your place, the YouTubes or whatever, sharing the channel, saying we have this subject, and that way you have been able to take it to the communities. Maybe right now we don't have a project for the Chizindalo, yeah? But if you do a story in your community and you feel that even the platforms we've put in, it would be helpful if it goes to Chizindalo. I know Chizindalos are very cost effective. Maybe let us know and we send that story to the Chizindalo in your community and we discuss that, because information, that's why Batembe are very good, and we are also discussing from a filmmaking perspective that if you're a filmmaker and you want to do box office as people in Hollywood, and yet Uganda there is no box office, then you have a problem. You have to start saying, where are the video halls? Because your audience is in what? Video halls. Where are the churches? Can they come in the afternoon? Where are the schools? Where are the, that's why we have projectors. Where are the mobile cinema? How do we go to what? To communities. You have to understand your market when it is advocacy and activism, and I think Joy was also alluding to exactly that. So it does not underscore us doing our platforms because it speaks to policy, it speaks to, but then we also want the community women, the people in health centers to get this information. What are the chances that probably if we do that story and we pin it, because now there's a task force, and we say, we tell the DHO or whatever, because that's how Native will also complement Mr. DHO. There's a story that came from your community, but we think it will be helpful if we print copies and put them in the corridor or on the notice board of one of the hospitals. That's communication. So there are different ways, and we are open to you guiding us. It doesn't mean that we may do all of them, because we also have constraints, but we will try, especially with your guidance. This story I already shared it with you, and I'm also going to play a bit of a video, but Herbert, I think, talked about it, and I think the doctor, but if we have intimate stories, and later I'll be talking about it, and personal experiences, those ones drive the message home, yeah? So for instance, here they said, here is what is scary about childbirth. Being treated, I shared it with you earlier, being treated for 9 months like the most glorious representation of womanhood, complimented, treated with care and respect, only to be treated on the day that should be the crowning day of pregnancy as less than an animal, with little to no respect or dignity, no real information, emotional blackmail, over giving up your rights, misleading information and isolation. Me and you here, we can understand that. But when you start talking rights, those people might not understand. But when you say, someone will understand a slap in our community to a mother who is delivering more than dignity to my body. Yet it's the same thing. So language is very important, how we use language, how we apply it to our reality, and understanding the audience that we are speaking to. Then there's someone who says, they sent a woman to the washroom outside. She delivered over there. Thousands of men were seeing her. A few men and women took her side in a very bad manner. What they meant is, went to, I said, to observe. I was having my 9th month of pregnancy. Having seen this, I returned home and decided not to go to hospital for delivery and get my babies delivered at home.
say or can't say. But from what we've heard and what we've been told, the normal practice is once a woman is in the labor ward, they'll check on her frequently. What are they looking for? They're trying to see how the labor is progressing. Now, when the labor is progressing, it means the baby passes through the cervix. You know that, eh? So they are checking, every time they check her physically, they see that the cervix is opening up. And at centimeters, and at some point they'll realize, now this one is ready to go into delivering the baby before its labor progressions, and they are monitoring. Now, think of a situation where she said she felt like she wanted to go to the loos, but she was just lucky that she said, but in the previous, this is the feeling I had. That already gave you an explanation that once the professor said, you will deliver in the morning, the other people who are in the labor ward attending did not pay attention to her anymore. But probably they didn't do it not only because the professor said you'll deliver in the morning. It so happened that they are attending so many other women who are ready to push babies and the like. Now, that should all paint to you a picture, honestly, of what goes on in a labor ward. When we talk about these private not-for-profit where some people are challenging, but how do they price? When you go to those hospitals, they'll assign a nurse to a woman in labor. So much so that she even spends time holding her hand. How are you feeling? Should we give you some water? Should we do this? Yes, it's okay to feel the pain. They will soothe their backs and whatever. You understand? You will not find that in our normal facilities. So that might explain some of the monies that some people might talk about. But the point here I was driving to is this, that if a woman is progressively monitored, there will come a time when it doesn't matter even if you can't tell the difference, okay? Whether you want to go to the washrooms or whether they'll tell you, no, you can't go to the washrooms, I think your baby is coming, eh? And now look at all that dynamic, and think of all the stakeholders in that labor ward. The truth of the matter is, there is so much that goes on. And I think what Sarah has just demonstrated to us is that sometimes maybe as journalists, if we can have access, which is almost not possible, but I can't rule it out 100%, it would be nice for you if you can get access to go to a labor ward. You don't have to see the women pushing the babies, but if you're given a chance to stand somewhere where you can just see what's going on, how the nurses are working.
Or listen to the screaming.
Yeah, if you say so, listen to the screaming, but it's not like it's a party. Fine, I'm looking for the whole experience so that it gives you an impression. Why do I say this? When I was studying journalism, the first thing that fascinated me about this craft and this profession is that you can study journalism after 3 weeks and you publish a story. Okay? So we were studying journalism and we were all given assignments and they said, pick a place, go and cover a story. I decided to pick Kampala Abattoirs. And I went there, stood around, talked to a few people, wrote my piece. Took it to the then chief, one of the editors of the features in Monitor, and he happened to be our lecturer. And he looked at my story. For him, the rule was that if you give him a story, if he gives you back your copy, and it's exactly the way you wrote on it, and he has just ticked on it on the top, that is a story that's worth running. Of course, I waited, and the following week, he gave me back my paper. And it was like a Christmas tree, lit with red, green, blue. I hated it because the comments in there were so demeaning. But after reading them, as he left the lecture room, he called me and said, Mona, I read your story. I hope you've looked at my comments. But let me summarize them this way. You went to the abattoir, but you are like a person who went there to buy meat. You are not a journalist. And he told me, I want you to go back to the abattoir. And he asked me, but do you know what time it opens? I told him, no. Because even in my story, I was writing even the timelines to really show I was there. And I was there at 8 in the morning. This guy is like, for you went to buy meat. You did not go to cover story. So he told me, go back this weekend. I want you to be at that place at 3:30 in the morning. And go and enter those slaughter rooms and houses. Guys, I went there at 3. And I started going through my rounds. What I experienced when I entered these abattoirs, I could smell the blood. I could smell the fear of the cows. Do you know that cows can know that they are being slaughtered? Have you ever seen the eyes of a cow that's being slaughtered? Have you ever seen its skin and the way it's shaking? Yeah. All these experiences I saw. And I wrote everything down. And when this guy came back, I tendered in my paper, my copy, and I waited. And when he came back on that day, of course he lectured as he usually does, and at the end he took out all the copies and started giving them out to the people. He did not give me my copy. I thought, oh my God, this is even worse. Yeah. And then as he was leaving, he said, by the way, Mona, did you see your copy? I said, no. You did not give me my copy. He said, what do you mean I did not give you your copy? I asked you, did you buy the papers? Did you read the papers today? And I was like, no, I haven't read the papers. He said, what kind of journalist are you? You don't even read papers. I said, you're published and you don't even know. And I read and I ran, picked the monitor, and my full paper was there. My first story. I was so happy, so ecstatic. But we need to be sometimes careful with our excitement. Because what that gave us was the confidence that, why should we go for lectures anymore? Then we started dodging lectures. This guy called us and said, guys, I don't care how many stories you've published. You're going to fail if you don't attend your lectures, you know? But why did that paper get published? And then he gave me my original copy back, and there wasn't a single mark. I did not even miss a period. And this is the kind of guy, he sees commas, he sees periods, punctuation and everything. No wonder he's an editor. You get the point. The point is, I experienced what it means to walk through the abattoirs. I was no longer a meat buyer. I was a real journalist investigating. So what I'm saying is that some of these issues, when we really want to get the nitty-gritties, we need to go. I talked to Solomon Serwanja about this work. At that time, we were trying to decide who is going to be our partner when we launch the Media Lab. I was yet to talk to Sarah and her team. Later on, I talked to Sarah. Of course, we were fascinated by the way Sarah does her work. So congratulations to Native. But when I was talking to Solomon, you all know Solomon, eh? Yeah. The BBC award-winning journalist. He now has an institute called African Institute of Investigative Journalism. Eh? So I went there and talked to them. But when I talked to him, immediately he started planning a story. He says, you know what, Mona, you've been talking and it's such fascinating stuff. And you know what I see? I see myself with a crew of people and a camera going somewhere in Igango Kamuli, identifying 2 women who are in labor. We want to follow them maybe 2 days before labor. We have to spot and identify them. We want to follow them. We want to leave their home in the wee hours as they go. We want to enter with them in the labor ward. We want to see this whole experience, to see the nurses, what are they doing? We want to see this woman with their baby back in the home. To me, that demonstrated an investigative journalist. He could see it even before he what? He visualizes it. So some of our stories have to be this deep, that when you sit back and you say, I've just spent 2 days going through this orientation about respect for maternity care, and I have this theme, what do I want to see? Where are my facts? Where am I going to find the data to back up what I'm recording? You know? And I want to go and spend a day in a labor ward. Actually, I want to understand what these nurses go through. Because we've been writing all these things about them, you don't know their world. After that long shift, don't stop. Go and follow them and see where they stay. Notice the things that they don't even realize you're noticing. Notice that this woman since morning has not taken a cup of tea. This woman since morning, I've not even seen her go to the loo to ease herself. Notice that instead of while others and these so-called politicians were enjoying their meat and, you know, eating their vegetables and whatever, this woman did not eat food and she's only taking a break at 3:30. How many minutes has she spent in this break? 10 minutes, and then someone had to drag her that we need your hands. You understand? Now that story talks about a person. Despite their flaws, it talks about their world. And if you publish such a story, trust me, there are so many people who are going to want to follow up on that woman. Now, whatever happens after your story is for you to celebrate. And that, for me, would be the best way you can do your advocacy. Because someone is going to come up and say, but I think we really need to go back and look at how we can support Nancy's. Government, the likes of USAID, other development partners, whoever. But it was all started by who? By Ashraf, who decided to do a deep story to really understand the world of a service provider, to really understand a mother who goes to a hospital without all the help that she has. That is how we look at it. And that is what will deliver our message at the end of the day. Sorry for interrupting, sir.
Thank you very much, by the way. Very, very useful interpretation and submission. And interesting, you talk about that. I remember you gave me a gig to cover something. So that time, I think my emotional side was not working. My business side was not working as well as the emotional side. Because I don't believe I delivered business-wise to you, but I delivered emotionally to you. Because what happened is I followed a birth attendant. Like people who came from when they came to when they delivered, even the delivery process. And then we went to hospital and followed how these people come to hospital. And let me tell you, when people are observing, imagine the camera was there. Nurses forgot, and they started barking at people. And we also followed that entire thing. But if I had looked at the business side, because the idea then was to discourage people from going to traditional birth attendants, but in a way this traditional birth attendant, the native came in, also came out as a bit of a hero, which I think didn't work so much for the kind of subject that was being told. But let me tell you what it did. Kavan was the cameraman that time, and he went with us. And let me tell you, the most lucky woman I know is a woman married to a man called Kavan, young man, because Kavan saw what women go through when they are in labor as a person filming. I felt bad for Ivan because the mother agreed, consented to us filming her delivering, even the baby coming out. Oh my God. Kavan, from that day, the way he treats his wife and children and the process, I mean, it doesn't leave you the same person. It doesn't. Even forget, yes. So
they call that the baptism of fire.
So that's it. But yeah, so I think that's great. Like, we are looking at themes, but probably we're also looking at what are you going to do as individual journalists when you want to tell certain stories and write messages home. And some of those probably might need more time than one story, and probably some of them native might not, but you could do it as an individual report, and it's also important to acknowledge that. I just wanted to share some of the stories, but I think they will divert us from the roles of a journalist, and I see we are running out of time. It's 5. So I'm going to miss some of the stories and go straight to probably...
we can recap on it tomorrow in the morning.
I don't know, because I don't know if time will permit, but we'll try. I also want to encourage you, because now I can't go into everything, because all these things also fit into the Universal Declaration of Human Rights, into the International Covenant on Economic and Social Cultural Rights. So when you're looking at the things that you are reporting, some of the things that you need to go to is looking at the policies and the laws, because there is something Herbert kept referring to and saying, but even if this person has not come with gloves, she is a Ugandan who is protected by the laws of the country, and probably the government committed to do certain things and services, and they should. So I want you to go also and look at these different rights that are covered for the women under like the International Covenant on Civil and Political Rights, the International Covenant on Economic, Social and Cultural Rights, the Universal Declaration of Bioethics and Human Rights, and the Universal Declaration of Human Rights. All of those, plus now the fact that we are also committed to the Charter as a country, and you already have aspects of what the Charter provides. Of course, we talked about why mistreatment continues. Some of the things are cultural, but I'm not going to go through them. I'll share this. The reality of midwives, I don't want to go through it because Herbert and Doctor have in a way talked about it. Long hours, little pay, lack of resources, the space in which they are working. Some of them have to walk up to home. Someone is called in, like she worked the whole day, and at night she's being called. All those things. It's also to lobby for policy. It's also to lobby that more people are recruited. It's also to lobby that communities respect and celebrate these people. It's also to lobby and encourage more people to train our health workers, because even our nurses, because they don't have. I wanted to play a very short video of breaking the silence. That one, I think it's about 3-4 minutes, because it will quickly take us through some of the things that we have to look at, and I think Doctor also hinted at them. What is respectful maternity care, freedom from harm. Please kindly play it quickly as I run to the narrative, because I see there's no time. The Respectful Maternity Charter, I will not talk about it because now I'm trying to save time. You already have it. You already have the document.
I also promise is that we are going to give you most of the key documents.
Yeah.
At least those that are talking about maternity health and maternity care here, and all the key documents you will have.
Yeah. So I also wanted to talk about key partnerships as media, because when the organization, like us as Native, we are also looking at key partnerships. Who are the key partners? So we are looking at reporters from print, we are looking at bloggers, we are looking at radio stations, because we are saying, okay, over like 70% of the audience is tuned to radio, or almost 90%, so we are looking at that. We are looking at Bizindalo, something that we had not actually thought about deeply, although when I'm promoting like our programming in communities and we want people to apply, we use Bizindalo. But this project I hadn't until you guys pointed it out, so it's not like your advice, we are picking it. But also you who are going to be your key partners. And let me hear from you, who are your key partners when you're doing this? Can you share briefly, who are some of the people you want to work with when you're going to go and get these stories? Can we run through them? Is the video ready? As you look for that video, yeah, that one, thank you. I'll let you know when to play. Can we quickly, who are some of the people you should work with when you're, as a journalist, when you're looking for these stories? Great, which organizations? Okay, thank you. Thank you. Health centers and health providers. Great, that's fantastic. Police, good, because they get a lot of statistics and reports. The community generally in its entirety, but how do you position yourself to work with the community is something I'd like to hear. Leaders. Yes, leaders. So you, traditional birth attendants, fantastic. Yeah, and working with them doesn't mean you're promoting them, but they're a very good resource and source of information. And Rwanda has, for instance, managed to bridge the gap because they work with them and have manage to change their goals, but also to persuade them to go back and get training. Village health teams. We have the district task forces. Play the video. As you play the video, I run to something else. So the media can play a positive role of breaking the silence by working on those. Sorry about the sound. Thank you very much. I think you have seen a lot of that. So when we are looking at the things they've already told you about freedom from harm and ill treatment, information, informed consent and refusal, and when we are talking about these, that's what the health workers are supposed to do. But us as journalists, when we go to these women and interview them, knowing the challenges, for instance, when you go to hospital, when you go to an area and the only hospital is the health center too, and the health worker there mistreated a mother or abusive, or there were no equipment and services, and you write about it and you put the names of the woman, we should go back to that health facility. So we have to also think about that, because we can't endanger their sources. So you have to be anonymous. If you're not, be sure the woman you're talking to understands Tell them, explain to them, I'm going to do this story. It is going to run on this television station. So and so many people will access it. It will have these effects. It might help other women. So that if they agree to being interviewed and their pictures being used. But then there are times when we say, a source who preferred anonymity, but then you start creating circumstances that show that was the woman that, hey, no, it can only be that woman. She's the only one who came in that day and they treated her like this. Then you have exposed her. It is very important when we are reporting that we are going to use very respectful language, that we are going to tell them what we are going to use the story for, that we follow up after we talk to them, that we conceal their identity if they don't want, that we give them feedback on the stories. And a lot of them, I know even I am saying this, but how many times have I gone back to some of the stories that I have done? But I've kept some numbers, I've tried to tell people your story is running, and sometimes you might never go back, but probably it helps to tell them or ask them, is there someone with a phone in your community because it was shared like this and that. But sometimes it's in a newspaper and someone is not able to, but tell them the impact that it will have. If there are risks, and this woman is so angry and she says, I don't care if you put me on record, still make it clear, because you also have to respect that wish. And we also know that the stories that are authentic are the stories where people are not concealing, because they say, why is that person hiding? But let the other people who came on record at least understand their rights, be protected, be respected. Empathy for you as people who are going. Because like we've been talking here, and it's okay because it's among us, and we probably say it shouting or whatever, we can say it to us. And don't think I'm coming on you, because I've also said the same thing. But how are we going to coin the language when we are interviewing these people? Because also sometimes it's embarrassing, but at the same time you want certain facts, so you have to call a spade a spade. Or how are you going to call a spade a big spoon and then the person understands you actually meant a spade? Because that's also a very tricky line to navigate, but something that we must do. I just also thought that when we've been talking about timely healthcare and highest attainable level of health, that sometimes is not in the hands of the women, or it's in the hands of the women, their families, but at the same time, the facilities. Liberty, autonomy, self-determination, and freedom from coercion. I have, some of these things sound like those things someone is even trying to have a baby. You're telling them how, Mbumanya, go and deliver in water. Even me, myself, I say Bazonga spoils. But it's a choice and it's allowed, but do we have it here in our infrastructure? But if we don't have it, does that mean that we cannot show or express to the people that those are possibilities that begin, especially with technology, because it has changed something. So some of the things that we really need to factor in when we are looking at mistreatment or what is perceived mistreatment, we have to look at the fact that there is shortage of midwives, nurses, and health workers who work long hours for low pay in challenging environments. So how do you look at that? Because can Uganda afford? If it doesn't afford, what are the solutions? Are we going to keep quiet? Because journalists have gone and said, you're saying that they work. How many people do we have? Is it right that they have less people? Have we gone to look for the budget? Have we gone to question the way Herbert said that? They are looking at people like the budget they approved 10 years ago, but the numbers have grown. Have we gone to engage people when it comes to budget, how the budget is allocated, and all those kinds of things? Shortage of resources, equipment, supplies, and emergency transport contribute to delays in care and stressed workforce. Lack of citizen accountability mechanisms, legal regulations to protect human rights. And first of all, like there's a story they were telling us that you did, and it ran in the newspaper. And the community didn't do anything about it. Probably the community didn't get to know. They were telling us when we had lunch, but you also hinted about it, that they approved a budget. And then local leaders sat. And the meeting was how to share the budget that is meant to look after people. Was it health? It was what? That budget they were discussing. It was Una, it was him. It wasn't.
No,
he did the story, right?
The story was in Kamuli. all of us know about it. Just story.
It's the one who told the story.
He told the story, but who wrote the story? Because he,
The person who wrote the story
is
did not come here.
Hey. Okay, so I'm totally confused. But you see, these journalists, they called him, they scared him. Is that the one?
Yes.
But you see, if the community had celebrated that particular journalist, it was going to be very difficult for him to also go back to that guy, because he would have become a community hero. And sometimes money cannot. But how many people in Kamuli read that story?
They read it, but you see, he kept on covering up, because even the community was aware that he had been taken to police. But then he went stealthily and met
the guy.
The GHO. Because the GHO was looking for promotion at the ministry. So maybe to not say that this man is a good man, he had to get another angle, which the government didn't even follow, but the government was aware of the first story. So even up to now, he's taken as a celebrity. But the other story.
But that is hypocritical. Yeah. Oh, how sad. Okay, so we were supposed to go into small groups and discuss different abuse scenarios, but if time permits, we'll do it in the morning. Because now we wanted to look at about 5 abuse scenarios. I don't think time will allow us. Even your brains now are kind of tired. So can you identify disrespect? I don't think we can do that now. So this framing the narrative and best practices, I'm also going to share it as literature, because now I don't see time for us to go into that. I see you're really very tired. But I think I'll just talk about when we come out with the themes. Maybe let's look for individuals that will put them out. Let's try to work with editors, because the war between editors and reporters will never end. Even for us, we are going to die and go. The other people who are going to come, because you do a story, the editor is saying things differently. But we can quote editors. You know, quoting the way you quote a woman or quote a man. We can quote editors. And now when we have these themes, we will have them at hand. So how is Native going to help? First of all, you're going to help introduce us to your editors. When you introduce us to your editors, we'll talk to them. I've already spoken to Moses Talema. By the way, sometimes it's a problem, sometimes it's good.
Moses Talema is not that the best, because
Williams Kato?
Maybe you can talk to Williams Kato or Linda Chipomo.
Hey, I don't even know Linda. I will have to look for her. Being a woman, it could help. So tell me, why isn't Moses the appropriate?
See, Moses is over there on weekend, but all the weekend crew is not that the best. Moses usually there from Saturday up to Sunday. But at least when you talk to Kato, whoever is going to say that send that piece, you are just aware that that's what is going to run. But sometimes you talk to
Linda.
Moses, you talk to Paul. That week is Paul Katantaze. Yes, please.
Yeah.
But at least for the weekend, those are the one who are working during the weekdays. Linda, you talk to there's Collins. At least they are okay. Yes, please. And even the other substation. I mean the channel 2 of
Spark.
Spark.
Yeah, Spark. I don't know the editor, but I know Peter Kaba, the manager. So if you give us their contacts and we try to quote them, but you also talk to them, because first of all they will think you have a lot of money. That's why these days you're doing only those stories, right? But if they understand that, and we are not going to talk to them about facilitation, because if we tell them we facilitate you to do stories, then for them they will misunderstand facilitation.
The will be that for us we identified some of the journalists who belong to your stations, and we work with them, and they are really passionate about their work and whatever, and we are working with them to put a campaign.
Yes.
So that they understand.
Yes.
We tell them this is a campaign that you see running on different channels.
Yeah. So the people of UBC.
But if there is a better of how you'd rather we took the narrative forward, and I say this because this gentleman is laughing. I don't know why he's laughing. It becomes confusing because then I don't know what he's thinking about.
No, he was responding
But
something different.
it helps if you tell us what we are supposed to raise. Here is why we say this. Collaboration is very important. It doesn't matter how good your work that you do. If we do not collaborate to the next level and change of management to build and quote and build relationships, that might also hinder your work and progress. And we're not saying we want to do it. If you feel confident we don't need to do it, then we're not doing it. But remember, try as much as possible not to work in isolation. You know? Like Sarah rightly said, if someone sees you that in the last 1 month you filed 4 or 5 cases, stories, good stories about maternal health, they will ask, you man, you're so interested in this. Maternal.
Yeah, so if we can, like Herbert said, but if you feel you can handle without our intervention, that's also okay, because some of you have good relations. Okay, then. Which next 10?
Just in next 10.
Hey, that's another one.
And then if you talk to them, they are cooperative, they will listen to you.
Then even if you have a paper, because we have pages for whatever stories.
But I also think the challenge with some of these editors is that they are so busy. But I think we should invite them for a workshop. Because no, to get an editor for a day to come and attend your workshop, even half day, it is difficult. No, we will go to the station, but you understand when you bring them together and you tell them that this is what we want to do and we would like your support as editors, not one editor. Then you go to them and quote them individually. That also helps. Yeah.
Now for me, you also help me with Semei on Urban TV, Semei.
But what I will also request is helping me with those details and numbers when we are done here, so that we go and talk to them. Yes, Asha.
The way you can handle those editors,
no, it's possible to
but
do.
The only thing you can do, you get their numbers.
Okay, I want to share that we've already quoted some, but I don't want to say who, because then you go and say those people already told us they talked to you. But we've already spoken to some, and we'll talk to others. But also, there are editors' trainings. So if you invite them as editors and give them ample notice, the problem is that was not factored in. So it is something that we have to first push. But once we push it and we ask them and give them ample time and say we have a maternal whatever at this venue and it's going to be half day or 1 day, which day works for you, they will come. Yeah, they will come. And sometimes it's good to have a conversation with all of them, so there's a general buy-in. And then you have the individual discussions. It also can help, but I hear you, but we will appreciate that. The other thing is, if we put out these stories, and in other media, like online, it is the conversation. Media houses will have no choice but to want to be part of that conversations. That's why you see we are saying we are going to do things. So if you do a story and your editor refuses, please utilize Native TV YouTube channel, utilize Chimp Report. If you fear that if we put your byline, that will be a problem, that's okay. Then we will put maybe a pseudonym or whatever. But let the stories. Yeah.
Take credit for your story.
Yes.
Tell them you saw the Chimp Reports. That was the story I brought to you.
Yeah. Yeah. And the people took it up and yeah. So and they will think, but we are not going to let stories die because editors have not run them. And then there is another thing. There are some of you who have cameras. There are others who do not. I'm not saying we will always be there. But if you're a radio journalist and you have this investigation that you're doing, and you feel we can profile it. And I know we don't have resources, but if we have ample time, we can send Joseph or Josephine or whatever to come and they profile with you. We just have to manage, because now it's resources. We just have to work with you in such a manner where you say, I've lined up the interviews, these are the people, whatever, come on Monday, I want to film. And even if you're not a television journalist, we'll support you with the television because it's you, and we'll give you the byline, we'll have the story come out. So that is also part of the other support we can give. The other support, as we have said, is we'll run the stories out there. We've actually been contacting people. There's a platform we have contacted, and we want to give them stories, and some are just interested in women's stories. So probably you don't have enough time, but when you do a story and they have refused, let's discuss. Let's see if we can put it international. Surprise them, throw it in their gut, and they refused it, but it ran on SABC or Voice of America, because also that's what we can do. I no longer have contact with the editor of CNN, but I can try again. The lady I used to work with left, but I can try again. But I'll try Voice of America, we shall try SABC, and we shall try other regional channels that we can. There is no guarantee they will run it, but give us quality, give us our whatever, and we'll make sure that it goes out.
There are some of these interesting stories that are now coming out, the way we handle them. You all know the famous program called Voices of Africa. When you look at their story plotting, most of them, they are looking for innovators. They're always looking for innovations. What is new in Africa? What's going on? And you see these people doing wonderful things. It's so surprising that if you look at the amount of stories that are coming from Uganda, they are quite a number.
Interesting.
I always watch Voice of Africa on Sunday on CNN. Very interesting programs and the way they cover them. You know, it's always interesting. It doesn't hurt. We can always write to them. They have all these channels, and we can write to them and tell them, look, we are doing, because we are also pushing fun initiative. What we are doing here, ladies and gentlemen, this media lab, it has never been done before. So you should feel honored. And we are all eager. We are all going to look eagerly to see at the end of that 2 weeks who filed which story. What was so interesting? So, by the way, keep in mind, it's not only something we are doing for the sake of doing our work, but we want to learn. If Ashraf is successful with his stories, what is it that he has that makes his stories tick? Is it because he's really an excellent writer, and I don't mean to disprove that? Or maybe Ashraf is managing his bosses and his colleagues in a different way that we haven't known. And he can give us tips and say, oh, by the way, do you engage your bosses? Do you do this and that? No. Actually, for me, I don't even talk to them. Come, start talking to your colleagues. You know, because let me tell you this, the biggest advantages when you're doing work in a professional world, you need networks and you need contacts. I'm telling you, you will be in a newsroom and you will be the best writer. But when your editor always pushes your stories aside, and they'll take bogus stories, with all due respect, from people you really feel are not really journalists up to your level. Why? Those people are managing relationships. When someone is comfortable working with you, they can even be willing to say, Sarah, the stories, bring your copies. And they'll take their time and rewrite your story because they enjoy the relationship that you have. But if you are this guy who writes very nice pieces, but you are bourgeoisie, you are too arrogant, you say statements that put off people, an editor is a powerful person. That's a floodgate. They will cut your stories off. And they are not accountable to you by the way. Yeah? So all these tactics we need to learn very quickly and build and strengthen these relationships because they are important to us. It's the same thing when we are doing our advocacy. Assurances sometimes help. You go to a source, and they'll know you're trying to investigate something or do advocacy that's really very sensitive. And they'll say, but Ashraf, please, don't poke our eyes. We know you're doing your job and whatever. And when you create assurances for them, you know as a journalist, sometimes you're going to find a story, but you really feel this contact of mine, this is a very powerful story. You tell them, guys, this story is going to run. Please, give us feedback so that we can balance, but it's going to run. That's how those guys who do investigating, they'll go to you and tell you that story is going to run, Uganda, okay? But if there is anything you can do, just give us and they're not saying to give me a bread to kill you. No, they're telling you it's going to run. But they're saying, let's hear your side of the story. Because maybe it will counteract it, it will balance, it will, you know? That is someone really being on your side, but telling you the story is running regardless.
Yeah, I've had people, thank you. Yeah, I've had people say, now what will, you know, they tell you this, and by the way, I'm not a saint, eh? I also did stories. And it is very hard to say you were a journalist and you never took money. It is very impossible. Yeah, right? So, especially because me, I remember one of the people who taught me how to get a brown envelope was Simon Kahiro. We went to cover, and you know Simon, don't give him money and you think you won't write a story. So we went and they gave us, and I said, Simon, he told me, Sarah, did you ask for that money?
Some good man was
But at that time, we are talking about 97, 98. 30,000 was a lot of money. So 30,000. And they gave us, I said, Simon, said, Sarah, did you ask those people for that money? What story are you going to write? Is there something you're lying about that thing? You get money and we could. Took money. But from that time, I was so scared. Because I wrote the other story, I didn't write a story promoting them, and that is how I have been by them. So if you give me money thinking that I'm going to change, that is going to be very difficult. But later I grew up certain mechanisms. For instance, I was attached to Parliament. So what I would do, I was not going to say you did something different when you didn't. I was not going to pray, and I was not going to keep quiet. One of the people, I think he was called Darlington Bakunda, he died. There's a time he had someone's wife and they had a child, and he wanted me to cover the story, and I refused, and he went to BAT, and he gave BAT 500,000. Remember, my salary that time was BAT's place I started with about 120,000. And I said, but I'm not taking that money. And BAT said, Sarah, I can't even tell you to take it because the next time they, you know BAT said, yeah, because if they come here saying they gave you money, I'll be the first one to fire you. Yeah. So I said, yeah, so anyway, I'm not taking that money. So I would refuse that kind of money. But I needed money because the money I was getting was not enough. So what for me I used to do as a person, because those members of Parliament, you say, I'm not being mean, but they are not very intelligent, some of them. And some of them are not very knowledgeable about what is happening. But they want to know, they want to run in the media. Some of them became ministers. We find a minister treasuring this small girl, Sarah, because maybe you contributed to that person becoming an MP, a minister. What do? You say, Honorable, I want you to be in the media the next week. And you know I can do it. But how? There's this thing cooking up. But what? You already have your information. There are these people who have stolen drugs. And this and that, and when you come out with that information, and I even have a strategy of how we can report it bits every day per week, but you go on the floor. What? Facilitate the research, Honorable. They facilitate the research because they want to be in the papers, yeah? I've never killed. There is no single time, no person will ever tell you that they killed someone or they did what, and I knew it and I kept quiet because I would never, yeah. And it's also a decision you're making. I'm not going to say don't do it, but for me as a person, I would never. But I was also not such a saint. But I devised other ways to do what? To get money. So there are other people who say, who is doing the story? That is the girl interviewing you. And that's how afterwards they introduced research assistants after our Gundi, our era. That's when they said, if Sarah is doing that story, she is not going to keep quiet, it is going to run. So you talk to her if you want, or be ready. And you have to also be that journalist who people know you're not going to compromise your professionalism. But we are human beings, so what are the other areas where you can look for money? For instance, Bart used to have another thing where he would say, if you have a gig and you want a camera, I'll give you a camera. So we would, for instance, I was covering Parliament Monday to Friday. So you would look for something on Saturday to do and get what? Some money to cover up. So I don't know what, but why am I saying this? I'm saying it to encourage you to, it might not be, you can use your journalism in many ways to get you money without compromising your professionalism and your stories, because you see these people also invest a lot of trust in you when they come to you with stories and tips, and then you just look the other side. One of the things, I was again at Media Plus and a girl came and greeted me, and I said, how are you? She was so happy to see me, and I'm not always that nice. Sometimes I also, especially when I am the one who is editing, or I'm not extremely very good, because you're not going to give me a crap story and I run it, and those kinds of things. But this girl loved me to bits. I don't remember. Then she said, you are the one who helped us when the church was stealing our land. The Catholic Church was stealing their land in Lubaga. Yeah, they with the help of a stepmother who did not want, she was not giving birth, she was not childbearing, and the man had children from his earlier marriage, and this woman was feeling bad that the land was going to go to these other people. She would rather the land goes to church. I went to that story, but the thing is, I'm not saying you do that, because even Bart told me, Sarah, this thing is becoming costly for us, because you do a story, you don't leave a story, you start now following up to help people get justice. You're a journalist, your work ends at this, but I'll follow up. So I helped her and we followed. I helped them and we followed. And the Catholic Church actually became embarrassed, and those people kept their land. So how do you want to use your journalism? How many times, for instance, you talked about a story when you went and there was an accident. When I was doing that particular documentary that you helped us get when we went to Kabale, they dropped a baby in a forest. So I was covering and someone brought the baby. Ants had gone in the eyes and everything, but the baby had no caretaker, and hospitals have concerns. If you bring a baby who has no caretaker, they first took in the baby was HIV positive, the baby was 4 years, looked 2 years. Now I had to use the camera in a bad way, because also sometimes you use the camera in a bad way, to blackmail the hospital into taking care of the boy. And they did, and then police heard that a baby was dumped, and police came. Why? Because for them it is money. A very sick baby who is dying, they said, first bring that baby and we take to police. And the hospital wanted to get rid of the what? The baby. And the police gets the baby, who doesn't have a mother, they don't know where the baby. I really quarreled with the police. But those are some of the days I've really survived being shot at. But for Lugalama Hospital, it was an opportunity now to get rid of it. So I said, we can't leave that baby. Now, police, they are so unprofessional, came and dumped the baby. The hospital closed and refused to pick the baby. And I had to get the baby to get treatment. So what I did is I told Ivan, film, let's walk. Sat on a border, went to Kabale Hospital. Now the main hospital, because that one is national, the other one is private, not for profit, Lugarama. It's a Protestant hospital. The camera helped that boy, and later, because I had to follow up, the baby got, I named him Biaruhanga because he was got from that place. I assumed he's a Westerner. And Biaruhanga means God's mercy, for God's grace. So the hospital looked after him, and I kept following, and then the last I heard, there was a Muzungu who took that baby. But am I the best person? No. But the reason that brought me to journalism have not changed. I don't know what your reasons are. But if your reasons are to serve, you may not become rich. And probably you could, because journalism exposes you to the right contacts. And I'm also aggressive. I remember one day I took a deal from men. For men, I went and I wanted money, because journalism can also make you too broke. So I saw people who can supply milk. I saw people who can buy milk. Honorable Matthew Richkire, when he was still a minister. So I just walked to his office and said, I'm here to supply you milk. Let me tell you, I didn't have capital, I didn't have the milk, but I knew the people who have milk. I knew The man looked at me and said, I like bold girls. I said, yes, that I am. I need money. They gave me the deal. But anyway, I failed to sustain it, but I got it. Why? Because as a journalist, I had the potential to walk in and talk to a what? To a minister and get a deal. You are exposed to a lot of information. You are exposed to a lot of contacts. You can also use them, hopefully in a manner that they don't distract you from journalism. This opportunity, I don't see it as an opportunity where you're going to get money, because to be honest, there's no money. It's if you look at the budget we got for the stories, if we are to pay someone, the best amount we would pay to facilitate a story would be 100,000, right? And maybe 50,000 for a story, maybe 20 for a radio. And this is not secret. I'm saying this because even the White Ribbon Alliance people are online. It is a fact. The money is not there, per se. But when you do this report, what are the other chances that probably there is a training elsewhere, and the White Ribbon Alliance and USAID, the first people they want to think about are those journalists? What are the chances that probably a documentary will come up? What are the chances that Native Voices has a documentary, and when we come to work in that area, we want to work with you because we've already worked together? There are very many possibilities. Herbert has a project that he wants to start. It is related to media, the media shop. We'll be telling you more about it. What are the chances? I cannot say I'm good and I'm the greatest, but a lot of the people who I've worked with, people like Samil, I think he wrote a story, and we've stayed together. So maybe I haven't yet brought a big deal, but at least when there's something, the first people I think about are people like Samil, because those are our family. So there are all those other possibilities, but most importantly, let us use these stories in a manner that they will expose all of us and open our other possibilities. So the other thing that we are also going to do is weekly live stream, where we invite people. So if they refuse to run your story, but we have run it in the weekly live stream where we've invited policymakers, White Ribbon Alliance people, whatever, and say this story was run by so and so, that's also okay. But the most important thing is we want to run them on your various platforms. And if your TV station refuses and we can put it on another TV station, we'll do that. But we are not saying your TV station should also try and lobby them and quote them. We've run out of time, we are tired, there's a lot that I want to show you, films, finish this, but I think I'll just share this as a handout. But time permitting, I might go through it. Are you in a mood for one more short film, or do we go and you watch later or tomorrow? Okay. Can we show them those skits, any of the skits? Oh, which skit have you downloaded? You first show them Political Patient as you bring a skit, because those ones are short. Political Patient was also a story that was covered in Western Uganda. It's not a film. Then we shall also, we did a project with GIZ and the IG about corruption. And that's why I'm saying these people of White Ribbon Alliance, we never even showed them but some of the things we talked about is corruption and how it affects the health sector and midwifery and all those. So we have 2 skits to show you. And they are short, they are between 3 and 4 minutes, so maybe you won't mind watching them. Then later, if you have time, or the people who come in the morning while others are still settling, we shall run more short videos. So which video are you showing us? Political Patient? Oh, and is the Askari ready? Or it's not? Okay, Tomorrow, Sawa. Okay, you're going to miss the dramatized skits, but we will show them tomorrow. For now, you can watch Political Patient. You will also watch a medical practitioner, like celebrating the people. We are celebrating people who are fighting corruption or giving back to society in the medical sector. Okay, let's start. We are done today, but they are able to. It is criminal if you go. You people found time to even make it that. But this thing has a problem, this sound. All right, so now, if you want, we can even show other films that are not that if you want to watch later, but if you want to sleep, you sleep.
What brought us?
Yeah, okay.
She's at doctor's hospital inside here. You will know that that's like about half an hour ago, so I need to go and find her. Oh. Okay. So they will have the
They might go and rest and come and the bubbles are some because
So I'll see you tomorrow. For what?
Kale, I will talk to Yolanda later. But do people want to continue listening to that sound? That sound is very, that sound is torturing us psychologically. Maybe they first sort it out, maybe they will watch tomorrow or later. You guys want to rest? What time do you want to come to dinner? Because it's not a buffet, so the people who are sleeping here, you just go and Native Voices and whatever, they are aware of you since yesterday.